or via Zoom. I'm going to ask our CAO, Mr. McKee, to lead us in the pledge. Can we get the announcement of the interpreter, please?
Hola, mi nombre es Omar. Yo voy a ser el intérprete durante esta junta directiva.
Perhaps we could also use this opportunity to remind folks in Spanish that we now have online translation available by hitting the globe at the bottom of their screen.
También ahora tenemos la opción disponible para escuchar esta junta transmitida en español. Para poder seleccionar esta opción, simplemente presione en el globo que está en la parte inferior de la pantalla y seleccione la opción de español.
Thank you, Omar. I appreciate that. All right. Any additions or corrections to this agenda, Madam Clerk?
There is a correction to the 1:30 scheduled PM item, and that is for item number 4.1, which is in receipt of a revised resolution, and that needs no vote.
And there's no vote required for that notification, Chair. And I do have a request for an addition to closed session.
Great. Then we'll go ahead and go to you for that now.
I would like the board to add on for closed session at after the morning open session pursuant to Government Code Section 54954.2B2, one item of significant exposure to litigation pursuant to Government Code Section 54956.9D2. The necessity for this closed session arose after the publication of the agenda for the meeting today.
And this requires a unanimous vote?
Yes.
Thank you. Okay, then I'm going to see if we have any public comment on that potential closed session addition. We ask that you use the raise hand function. It's at the bottom of your screen or bottom of your participants tab. If you're participating via landline, *9 will raise your hand and let us know you wish to be recognized.
I'll move those changes.
I'm going to bring it back to the board. Supervisor Alejo has a motion.
Second.
Second from Supervisor Parker. Roll call vote, please.
Supervisor Alejo?
Aye.
Supervisor Phillips?
Aye.
Supervisor Parker?
Aye.
Supervisor Adams?
Aye.
And Chair Supervisor Lopez.
Aye. Motion carries. That addition has been made. So that business having been conducted and added, we're now going to enter into our scheduled matters, beginning with our first item of the day, which is to adopt a resolution authorizing and directing the Auditor Controller to make some modifications and changes based on direction given by the board. It's a presentation. Chris Donnelly of the Workforce Development Board. Mr. Donnelly, the floor is yours.
Good morning, Chair Lopez and Supervisors. The Workforce Development Board is coming to the Board of Supervisors to ask for adopted resolution to approve additional $800,000 in CARE Act fundings for the Small Business Relief Grant. This funding is coming from additional funding or unspent funds from the Health Department from the Great Plains program. So the funding would be used to look at moving forward with some of the additional grants that we have right now in place. As I mentioned last week, we have 135 grant applications that have been approved, totaling close to $1.4 million. So the additional $800,000 of CARE Act funds would probably replace the cannabis funds, and we would like to use the cannabis funds at a later date for a second round of fundings for the small business relief grants. So we're asking the board to approve the resolutions that are part of the board packets for the additional $800,000.
Any questions from board members? Okay, I'm going to take it out to the, Supervisor Adams.
Well, that's okay. We can go to the public first. That's fine.
Okay, I'm going to go out to the public at this point, see if we have any public comment on this presentation. Remind folks to use the raise hand function. See no hands going up via Zoom and nobody coming forward in room. I'm going to go ahead and bring it back to the board, and Supervisor Adams, floor is yours.
Thank you. So for clarity's sake, we're being asked to approve the transfer of the CARES Act funding from the Health Department to the Workforce Development Department, and also leave more than $800,000 of cannabis funds in the Workforce Development Board for future use.
Yes, that's what we'd like to make the recommendation, is that the cannabis funds were approved last week.
Right,
because we didn't have the funding to cover all 135 grants. So with $800,000, we could be able to expedite those payments and get the money out and spend the CARES Act funds that are due by funding, or expenditures have to be spent by December 31st.
right. So I guess what what I want to know if we can do, the reason that I keep pulling all of the cannabis assignment issues is for transparency, because we told the public that we would spend it just as they know it. And even though we have already said that this is what we would do, I'm kind of concerned because we don't know what the circumstance will be in 6 months or so, whenever we may need this, if we will even need to do another round or if we would need more. So my suggestion, and what I would prefer, of course, is that we put the cannabis funding back in the assignment account. And then as time goes by, if in fact we need to have additional funds for this particular program, then we would publicly, again, take it out of the cannabis assignment account and put it back into the Workforce Development Board account. So
Thank
I
you,
guess
Supervisor. Sorry, didn't mean to cut you off there.
that's okay. So I think what I guess I'm saying is that I would like to make a motion that is what we would do. And I don't know if we need to have, I would expect that there will need to be some discussion around this. So if the time is correct at some point, I would like to make a motion that we accept the funding from the Health Department to the Workforce Development Board for the program, and that we return the cannabis revenue to the assignment account until it is needed by the Workforce Development Board.
All right, I'm going to go to Supervisor Parker next. Supervisor Parker.
Thank you, Mr. Chair. And I see where Supervisor Adams is going, and it's similar to conversations that we've had about money within the capital funds and so on. So I think it may be a good idea, but we could also hear from Mr. Vega, because sometimes the money doesn't get transferred over to the department, but it's rather on a reimbursement basis. So it may still be in the cannabis assignment essentially. So I think we'll want that clarification before we get to the point of a motion. But I think the point I want to raise is sort of also kind of a larger one, which is just as we know, part of our conversation yesterday and this action today really raises the point that we know that there are going to be ongoing needs to provide assistance to our community in 2021 beyond the ability of the CARES Act funding to help finance those things. So what I'd like to request is that Mr. McKee convene the budget office and the departments to really sit down together and scope out what programs and services do we think are going to be needed in the new year, including these, the equity metric, any of the other supports that we know have been so valuable to the community, and map out a 3-month or a 6-month plan for how much might need to be done, make it as comprehensive as we can, and propose where some funding might come from, so that early next year the board can make a decision in a coherent manner. When we get these things one by one, we all want to support them, but it's hard to know how they fit into the big picture. So I think it'll be really key for us to be clear about what our priorities are going forward, where we might find the funding. Maybe there will be more federal or state monies coming to us to help finance those things, maybe not. But I think really looking at it in a fairly comprehensive way will be important, so that we aren't just kind of in a reactive mode, but rather taking thoughtful, deliberate action according to our priorities and the availability of funds. Thanks.
Can I point out something, Supervisor Adams, is that we still are short by $100,000. So we would have to tap into the cannabis funds to make whole all 135 grant applications as well.
That's fine. That's fine.
Good clarification. I'm going to go to the
Thank
CAO
you.
for some brief comments, and I'm going to check in with Mr. Vega based on that question about process on the funding. So first, CAO McKee.
Yeah, thank you, Mr. Chair. And Mr. Donnelly spoke to the one issue I was going to talk about, which is I think there's still a shortfall, number one, and two, that I think as everyone recognized that we're unlikely to see the end of the tunnel before there will be some additional need, but hopefully that we'll get some additional funding coming from through the federal government again with another package, a CARES type package, and that maybe we won't have to come back and ask for additional monies from the cannabis fund. That being said, the CARES Act funding, what it did was provide kind of what Supervisor Parker is asking for up through December. So we brought to the board the proposal early on as far as here's how we think spending would happen for the next, I think that was brought in July, if I can recall correctly, from July through December. We still get these one-off requests that we've tried to address, and what I would say to Supervisor Parker is it's a good idea, that request, and I don't really think we need to have a motion in any way on that. I think we can take that as staff and understand that's something that we should be doing and bringing forward to the board in early 2021 with the assistance of Mr. Vega, Dwayne Woods, and all the departments who are involved.
Thank you. I'm going to go to Ezekiel Vega next to answer the question about the process in terms of whether the money has been pulled from the account, the cannabis account. Mr. Vega?
Yes, regarding the process of the transfer of cannabis funds, we typically do not transfer the funds upfront immediately or after approval. We typically do it on a reimbursement basis. So since the board approved this action last week, it is highly likely that that transfer has not occurred yet. So we could have the same effect of what Supervisor Adams requested, just by ensuring that we do not make the transfer of the cannabis funds. First, we make sure that we use CARES funding first, and then if there is a need, we may transfer up to 100,000, as Mr. Donnelly indicated, may be needed on a reimbursement basis. So that means the action that you already took will give us that ability, and then administratively, we just make sure that we do not transfer those funds unless absolutely necessary in the second half of the fiscal year.
Thank you.
Thank you, Mr. Vega. I'm going to go to Supervisor Alejo next. Supervisor Alejo.
Thank you, Mr. Chair. On this item, I don't agree with putting the money back in, and there is no lack of transparency. We voted clearly, very transparently last week, and we're doing it today. But two things: not only that there's still a shortfall, but second, that there's still a great need in this area. Businesses, the potentially collapsing businesses are going to grow, not lessen. And at a point where where Congress actually passes another package, at that point, I would say if new funding is coming, we should maybe consider scaling and putting that back, but not at this moment in time. And even if Congress passes something, it's going to take some time for that to get to the state government, and then the state government figure out how it's going to allocate it to those counties below the 500,000 person threshold. That is what happened with our CARES funding. We didn't get the direct allocation like the big counties did. We had to wait for the legislature and the governor to decide how they were going to formulaically distribute that to the smaller counties. So at this point, because of the great need and because of the tremendous pain that many of our small businesses find themselves in, I think we need to keep that money there for its intended purposes, not just start moving money back and forth. We already approved it and allocated for this purpose. The purpose is still there, and I think we should keep it there. And I would love to hear what my other colleagues think that haven't spoken. But I think this is the right thing to do at this time. Keep the money for its purpose. Our businesses really need it at this time. Thank you.
Thank you, Supervisor Phillips.
I liked Supervisor Parker's idea of looking at the total package and where we are next year, but some of that's going to be determined on what's happened federally. But I mean, on the cannabis, I know we went out did outreach with the community to see how they want to use the money, but I don't know of any commitment that we made the money would be used for A, B, C, and D. We heard what they had to say, and we've made decisions keeping that in mind as we go along. But we couldn't make a commitment. It's a general tax fund, so we actually couldn't make a commitment. But I think leave it where it is, and if we had to make modifications down the road, some of this money may be needed for the COPA project that we talked about that we wanted to institute. Hopefully we can get some state funding for that. I think we could get Senator Caballero's support and Rivas's support maybe to get some state funding for that project. But if not, we may have to use cannabis funding for that too. So.
I agree with you with that would be a perfect place for this money to be used. But the money will be already tied up at the Workforce Development Board if we don't, as Mr. Vega had suggested, not draw it down because it will not be needed more than $100,000 for this particular project. And then we can once again, it's not like I'm asking for the money to be put in specific kinds of places, but we did say we would be absolutely transparent about how we spent it. And I think the public would want to know that we were going to be spending it on something like the COPA project. I think that would be fantastic. So I'm just asking for transparency's sake.
We are being transparent, though. There's no lack of transparency whatsoever. I don't know why that keeps being mentioned. This is transparency. We're doing it right now in the most transparent way possible. By putting money back into account, we're just putting money back to sit there that it's not serving any purpose. When we allocate it for this program, we're putting it and designated for its use to help our businesses during this pandemic. Thank you.
Thank you, Supervisor. So we've heard from nearly everybody, and for me, when I think about our budget and the way we move money here, I'm okay with leaving it where it is at this point and continuing forward into next year. I know that there's going to be additional moves necessary depending on whether or not additional funding comes from the state and feds, and I'll use this opportunity and this platform to request that funding. Yet once more, we need additional help to our members in Congress, our state legislative leaders. We need your assistance for local businesses. There's a lot of demands on the locals here, and I know that a lot of you have shared with us that this is where the rubber meets the road, so we look to you for your leadership on that. So at this time, I'm going to turn to the board and see what their will is. I will share that I see some hands up via Zoom, but at this point we've already opened and closed public comment on this item, and so that time has passed, and at this point I'll leave it up to see what the will of the board may be.
I'd like to move staff's recommendation.
Second.
I've got a motion and a second. Roll call vote, please.
Supervisor Alejo?
Aye.
Supervisor Phillips?
Aye.
Supervisor Parker?
Aye.
Supervisor Adams?
I will vote aye only because I want the money to come from the health department that is not going to be spent through CARES. But I fully disagree with the other element of this, not because it is not being absolutely transparent, period. Thank you. So I vote aye.
Thank you. And Chair Supervisor Lopez?
Aye. The motion carries. With that, we've concluded our morning session. We're going to recess to closed session, and we will be reconvening here at Chambers at 1:30 to take up the afternoon portion of our agenda. Thank you.
Mic 5, test, test. Mic 7, test. Mic 8, test. Mic 10, test. Staff, test. Staff mic test.
Clerk's mic, test, test.
Podium test.
You want to do the wireless?
Interpreter?
Hello, this is Julian from the clerk of the board's office. Can we have a test from the interpreters to see if you guys if we're able to hear you guys? Hilda, you're on mute. Can you unmute yourself? Or you might be on mute. Actually, no, you're not on mute. Okay, IT's gonna go on there with you right now. Andres, are you on yet? Not yet. Okay, let's try this again. We're not able to hear you guys yet. Hilda, is it possible for you to leave the meeting and then come back in? Hello, this is Julian from the clerk of the board. Andres, our Spanish interpreter, are you there?
Hi, this is Hilda, the Spanish interpreter.
Yes, we're able to hear you. Thank you.
Oh, thank you. Okay, good. Thank you.
Is it possible for you to take the first 45 while we try to get Andres to log on?
Yes, that's perfect. Thank you.
Thank you. Andres, if you are there and you're able to hear me, can you log out of the meeting and then log back in for us? Thank you. Andres is not responding.
Good afternoon, everybody. I'm going to reconvene the Monterey County Board of Supervisors. I'm going to please let the record reflect that all members of the board are present, either in room or via Zoom. Can we get the announcement of the interpreter, please? And can you also let the public know that online interpretation is available? Thank you.
Buenas tardes, mi nombre es Jocelyn Martínez, hoy seré la intérprete en español y también tenemos interpretación vía Zoom.
All right. I'm going to go to County Council for an urgent addition to this agenda.
Thank you very much, Honorable Chair, members of the board. Earlier today, the Monterey County Health Officer, Dr. Edward Moreno, indicated he would be signing a local health officer order that would go into effect Sunday evening, the 13th at 10 p.m. Given the nature of the order and the current conditions, staff felt it was appropriate for the board to consider a resolution in support of the county health officer in issuing this order. Dr. Moreno is available and can set forth the reasons why. If the item is added to the agenda, I would just point out that the reasons have become apparent in the last few days, that the rate of hospitalizations and the ICU capacity in Monterey County hospitals has reached a critical point, and we cannot wait to take further steps to help stop the surge. So I would ask the board to vote to add an item, a resolution supporting the Monterey County Health Officer in issuing a local health officer order, and that would be pursuant to Government Code Section 54954.2b2. And as I said, we just learned of this morning, so that is why this would be an urgent add-on. Thank you.
Okay, so the request is to add an urgent add-on to this agenda. We need a vote to add the item to the agenda. So at this point, I'll see if there's any questions from members of the board before I go to the public on the first action. Are there any questions from board members? Seeing no hands up, I'm going to turn to the public. I have two hands up from the public, a Connie Reeves and a Nick. And again, this is, it has to be focused on the addition of this item to the agenda. And so I'm going to go ahead and start with, well, hands are disappearing. I'm going to go ahead and start with Nick. Nick, we're going to give you the ability to unmute yourself and share a 1-minute public comment with this board. Nick?
Sorry, my hand was raised for another agenda item, so I yield my time. Sorry.
Thank you. I'm going to go to Connie next. Connie Reeves, we're going to go ahead and allow you to unmute yourself and share a 1-minute public comment regarding the addition of this item to the agenda now. Connie? Connie Reeves. Okay, we're going to go ahead and move on, Connie. Since we're not hearing from you, I'm going to go to Antoinette Gorich. Antoinette, we're going to give you the ability to unmute yourself and share a 1-minute public comment with this board now regarding the addition of this item to the agenda. Antoinette?
Okay, can you hear me?
Tenemos una persona del público
Yes.
que va a hacer su comentario.
Thank you so much. I had originally called to make a comment in favor of stopping the homeless sweeps. And given this new agenda item, I feel like the two are very connected in terms of what I was going to bring up in terms of the effect this approach is having on the transmission of COVID and the situation that we're in right now because of it. So if it's being added to the agenda, I would ask that the board also includes a discussion of stopping the sweeps as a part of that shelter-in-place order.
Para el shelter in place.
Thank you for your comment. We appreciate that. Seeing no additional hands, I want to bring it back to the board. I see a hand up from Supervisor Alejo.
Yeah, I just wanted to raise my hand to make the motion that we would add this due to the urgency of the announcement. So that's the motion, sir.
Second.
Thank you. I've got a motion from Supervisor Alejo, a second from Supervisor Phillips. Roll call vote to add this item to the agenda. Council Gerard? Okay, thank you. Roll call vote, please.
Supervisor Alejo?
Aye.
Supervisor Phillips?
Aye.
Supervisor Parker?
Aye.
Supervisor Adams?
Aye.
And Chair Supervisor Lopez.
Aye, the motion carries. With that, I'm going to turn to County Council. We will take up this item now.
Thank you very much, Honorable Chair, members of the board. I have a draft resolution with supporting documents, which I'll share with you later. But first, I'd like to ask Dr. Moreno to explain to the board and the public what the order constitutes and perhaps the basis behind the issuance of the order today. Dr. Moreno?
Yes, of course. Thank you, Les. Good afternoon, Chair, Board of Supervisors, and the public listening today. I'm coming to the board today because I have been communicating over the last week or two to the board that I have significant concerns over the data, health data and public health data here in Monterey County. And this data is coming from reports from the hospitals that they submit every day to the state, and that gets reported out, and we've been tracking that. The state's been tracking, we've been tracking it. But there's also, we have weekly meetings with our hospital partners, and they've been informing us that they have concerns that their beds are filling up with COVID patients, in addition to their
like
regular
Dr.
patients.
Going to put the order in.
So we also have, I've been meeting with several times a week with my health officer and health director colleagues throughout California, but in particular here in the Bay, Central Coast Bay Area. And what we're seeing is as the state implements its new stay home order, the trends in some regions, particularly Southern California region and the San Joaquin Valley region, the trends in terms of their ICU capacity, which is the metric that the state is using to put regions of counties into a more restrictive status, continue to worsen. Those two regions went into the more restrictive stay home order status effective beginning of this week in the hopes that in addition to continue to encourage residents to stay at home, to not mix with households either privately or publicly, because that's how transmission spreads, and to follow guidance in the workplace. In addition to that, the stay home order would add to efforts to reduce transmission in those affected counties, in those affected regions. Last week, the counties of Alameda, Berkeley, City of Berkeley, Contra Costa, San Francisco, and Marin, Santa Clara, all determined based on their analysis that should they wait for the state to pull the trigger on putting our region into a more restrictive state, that they would more quickly reduce their hospital and ICU capacity, and that they could run out of hospital beds and staffing before the end of this calendar year. And so those counties did implement the state's stay-at-home order and all of its restrictions earlier. So those went into effect this past weekend in those counties. So in this area, we have, in California, we have those counties. We have the Southern California counties, which includes San Luis Obispo, and the San Joaquin Valley counties, which include San Benito, all in the more restrictive status for California. And as I look at our county and the remaining counties in the Bay Area, Central Coast, what I find is that we are following, unfortunately, we're heading in a downward trend as well in terms of our ICU capacity. What's happening, according to our hospital colleagues, and they have expressed this to you publicly, is that essentially, regardless of what the state metric is saying, their hospitals are essentially full, and they are placing ICU level patients in places other than the intensive care units, justifying rooms, justifying beds, and they're concerned that they, with the amount of difficulty it's taking them to continue to find the nurses and the doctors and the ancillary staff, respiratory therapists and others to care for these patients that are filling up their hospital beds. So that in mind, I'm very concerned that if our jurisdiction does not take additional measures to reduce mixing of households, which is contributing to the spread of this virus, we will soon run out of hospital beds for any one of us that needs an ICU bed, whether that be for severe COVID illness or stroke, heart attack, or trauma. And so I'd like to give you, and based on that, I just finally decided that it is time for Monterey County to move into the state's more restrictive status in alignment with the state health officer's stay-at-home order. What I would like to do is share with you the most recent data that I have, if you don't mind. Are you seeing the slide, supervisors?
We are.
Yes.
All right, so I have shared this with you. This is where we've been, the blueprint metric, and you can see that we are at, we started today in the purple tier. You can see here that our case rate continues to rise. These are weekly case rates, and our case rate is in the area of 37 per 100,000. And our positivity rate, which at one point was down at between 4 and 5% positivity rates, we're at 11% countywide and 15% in those communities that are most challenged and most vulnerable. So the stay-at-home order, what this does, so what I did, excuse me, let me back up, supervisors. So I did draft and had county council review, and I did sign the order this afternoon. And this is generally what it does. I have shared this with you before, but for those that haven't seen it before, the California Regional Stay-at-Home Order was issued December 3rd by the State Health Officer and went into effect December 5th for Southern California and for San Joaquin Valley. And again, San Luis Obispo and San Benito are now included in that. And in effect, as I mentioned, regions that have less than 15% ICU availability. Encourages people to stay at home and to not participate in unnecessary non-essential travel. Retailers can operate at 20% capacity and grocery stores at 35% capacity. There is growing evidence that shows that we can still reduce transmission of COVID-19 while allowing certain business sectors that bring in the public, such as retailers, to still operate at reduced capacity. So based on studies that have been conducted in some of the larger cities in the United States, there is evidence to show that you don't necessarily have to shut everything down. You can reduce capacity and keep some businesses open and still have an impact on reducing transmission. So that's the rationale behind keeping some businesses like retail and grocery stores open, but at limited capacity. Restaurants can provide takeout only, and masking is still required if you go out of your house. Schools can remain open, and the schools that have waivers that were approved by the state can have their students in the classrooms. Physical activity is highly encouraged, and gyms still cannot operate indoors, but they can operate outdoors because it provides an opportunity for residents to be physically active. So I'm providing you an update on where we're at as far as the metric. And supervisors, please keep in mind that we are already a place where our hospitals are full. So what this provides is more of at this point, a trend that we can follow. And so what I'd like to show you is that even in those counties that have already implemented, unfortunately, they just implemented a couple of days ago, so we're not seeing the effect of the new restrictions, but they are having a downward trend. So this is the San Joaquin Valley is having fewer and fewer ICU beds available. Southern California is also having fewer and fewer ICU beds available. Sacramento area has reduced over the last 5 days, reduced ICU bed availability, and they, according to today's the newest data, they are also may have reached a threshold. As far as our Bay Area, Central Coast Bay Area, we are overall the last couple of days been heading downwards, and for us, this is the purple line. It does go up and down because we are smaller than some of the large counties and definitely much smaller than the entire region. Overall, it appears that we are slowly decreasing our ICU capacity. But again, this is the important thing here is that it's a trend because we already know from our hospitals that they are full. So I will go ahead and stop sharing for the moment and do my best to answer questions from the board.
Questions from board members? Supervisor Parker.
Thank you, Mr. Chair. Thank you, Dr. Moreno. Clearly, we've been hearing that the capacity at our hospitals is much more constrained than what the data might show, and that table that you just showed where I think it was Sacramento looked pretty good a few days ago, and within a couple of days has fallen below the metric. I guess I think you said that you have signed the order. Is that publicly available?
Supervisor, I just signed it just now.
Excellent. Thank you. Is there going to be a press release or something issued so that we can start to put the word out about this and what it means?
I do have a press release, and both the order and the press release are being translated into Spanish.
Great. Thank you.
Thank you, Supervisor. I'm going to go to Supervisor Adams next.
Thank you. Thank you, Dr. Moreno. And as painful as this is for so many of the small businesses around here, I've spoken to a couple of the large employers who understand exactly why we need to do this. So as difficult as it is, I think that you have at least some members of the public certainly understanding. So I just wanted to ask about the new order then. Are we essentially going back to exactly where we were at the very beginning of this as far as restrictions goes, other than the fact that schools are allowed to remain open?
That's a very good question, Supervisor Adams. The order is not exactly like the order we had early on. You make a good point. The schools, there is a difference with the schools. If the schools have a waiver, or if other counties were had school children in classrooms before this took effect, they can stay. We do. This order is a little different because it's been adapted and includes things that we've learned along the way. So, for example, worship, for example, is still permitted. It is permitted outdoors, but worship is definitely permitted. And there's also, if you may recall, the other thing is we do recognize that essential services must continue. And so the essential services that can continue include, if I may, let's see. The state of California has a website that people can go to look at what an essential service is. And so that's what we're going to be recommending that individuals in here in Monterey County want to see what's open can go to the state website.
Okay, great.
Yeah, I believe that there's a lot more emphasis on outdoor activities than there was initially. Gyms outdoors are still allowed. We're still encouraging people to go to parks to get physical activity. So there are some differences, but I think the similarities that most people will be familiar with is that certain businesses will have to be closed altogether. So the personal services like the salons, the barbershops, the nail salons, the body art will need to close. But that list is also on the website.
Thank you very much, Dr. Moreno.
Supervisor Alejo.
Thank you. Dr. Moreno, these times have been difficult on everyone, but they've also been especially difficult for our youngest constituents in our county. With this order, I know the governor recently made some changes, I think overnight, on guidance about playgrounds. Could you explain what the availability playgrounds will still be for parents and children?
Thank you, Supervisor. So one of the things that I'd like to share is that when the order first went into effect last week, there were a lot of questions without many answers. And so the state of California has been, specifically California Department of Public Health staff have been working to update that. And one of the issues that I think was still to be resolved was whether or not playgrounds would open and close. So I'll have to go back and check to see if that's what the case is.
Yeah, I think it was just posted this morning that they would remain available for families, but it was done not with the big announcement, but certainly one that a lot of local and state legislators were talking to the governor about. Besides that question, I just wanted to take a moment to thank you. I know this wasn't a easy decision, and unlike the opportunity to jump with the other Northern Bay Area counties, you and the health officer from Santa Cruz County took time to reflect, to check in with the Board of Supervisors, really hone in and look closely at the data and make a determination that best fits Monterey County. And I think we've come to that point, as difficult as it may be, from hearing from small businesses and other residents. I think there was an expectation that this was coming soon. And it was something we kept asking if it was coming, but today you provided that clarity to our community. And it wasn't like it was going to be done overnight. I think it's with over 72 hours notice on Sunday at 10 p.m. So it gives that additional time to make preparations and adjustments. But today, for example, it was hard not to reflect and see and just recognize how difficult this moment in time is. It's probably the most challenging time in our lifetime, certainly in the last 100 years or so of United States history. But to see 10 deaths in one day of our local residents, it is just tragic. It's heartbreaking. It hurts. And I could just imagine what these families are going through every day. We put up numbers of people who lost their lives to this virus. My good friend, former Salinas Council member Sergio Sanchez, lost his mother just a few days ago, and it was difficult to hear him how hard it was not to be able to be around his mother at the hospital, and I know our nurses and our doctors have expressed that to our residents, how difficult it is for them to see their patients not be able to be surrounded by loved ones at the most difficult time. And so that's why I implore our residents to take this seriously. It's not just for themselves, it's for those they love and care most in their lives, their family members, their friends, their neighbors. This is a time that we really need our residents to do what is difficult, and hopefully with making some changes these next few weeks, we could turn these numbers that keep getting worse every day. We could turn them around and save lives, and really show that Monterey County can come together during the most difficult times in our lives. So I wanted to just express on behalf of my constituents in District 1 in Salinas. I know not everyone's going to agree, but it's just that bad when we're losing so many lives. And I just ask everyone to put themselves in the shoes of if this was your family member, how would you respond to that? And I think when we reflect in that way, we take it with the utmost seriousness. That the actions, as the difficult actions that we're having to take today, are to save the lives of our residents. And I know all my colleagues care about each and every one of our residents. And so I hope that we will all stand together, united, and standing behind your order here today, because we know that this is about the safety and well-being of our residents, and we want to fight this virus and turn things around. And up until we get to the point where we could implement effectively a vaccination program for our residents, giving priority to our most vulnerable in our county, we have to keep taking these measures to hopefully save as many lives as we can over the next several months. So with that, Mr. Chair, I thank you for the time.
Thank you, Supervisor Alejo. I'm going to go to Supervisor Phillips.
Yeah, Dr. Moreno, it was mentioned it's a tough decision that you had to make, but everything that we've seen, that we've heard from the hospitals in the last couple of days, and with the death toll that we saw today, it's clearly necessary. So having everybody's not going to agree with this, but having sat on the bench, about half the people walk out of your courtroom aren't happy with the decision you make. So I appreciate the tough decision you made. Question though, I assuming this the restriction on retail of 20% applies to the big box stores too, where I think a lot of the problem was, or at least a lot of people are congregating in some of those big stores. So I think that's important that we emphasize, if that is the case, that it applies to them also. And as I mentioned, we've still been having parties out in North County. So I'm assuming all those are forbidden. So if we see those starting up, we can get someone out there to make sure that they disband if that's occurring. But both of those things are restricted, correct?
That's correct. Yes, and the gatherings are not allowed, and you're right. That's one of the contributors to transmission of COVID-19. That transmission within the home, and we still have individuals who are having exposures in the workplace, which is really important to acknowledge that even though these orders are in place and should help to curb transmission, people still need to wear face coverings. They still need to keep distance, at least 6 feet distance. They still need to wash their hands frequently and use hand sanitizer. All the things we were talking about are still in place and can still help reduce transmission.
Okay, we'll do what we can to make sure that doesn't happen in North County anymore. So thank you.
Thank you, Supervisor. Now, before we open it up to the public, what I want to do is ask Council to share with us the language that he's proposed today.
Thank you, Honorable Chair, members of the board. I'm sharing my screen. I have a resolution that recites more or less the history of the statewide and local orders. On the first page, recites that the state issued the limited stay-at-home order in November, that the cases have continued to increase precipitously On December 3rd, the governor and California Department of Public Health issued the regional stay-at-home order. Describes what the regional stay-at-home order generally does. Talks about the fact that neighboring counties, San Benito and Southern California, San Luis Obispo rather, which are in different regions, are currently under the regional order. That we're in the Bay Area, that some of the counties in the city of Berkeley have decided to implement the regional order early. Recites the fact that we're reaching critical capacity both generally and in ICU units, and therefore the Monterey County Health Officer has determined for the protection of the public health, safety, and welfare to issue his own health order implementing the regional order early. And the resolution is that the Board of Supervisors of the County of Monterey, for the reasons set forth above, support the issuance of the local health officer order by the Monterey County Health Officer, implementing the provisions of the regional order effective at 10 p.m. on December 13th. There are some attachments. I've attached the regional order. I've attached the press release from some of the Bay Area counties and a copy of Dr. Moreno's local health officer order. So we would ask that the board consider adopting this resolution in support of Dr. Moreno. Thank you.
I'll move to approve.
I'm going to go to the public first, Supervisor. So at this point, I want to go ahead and open it up to the public to see if we have any public input on the presentation that we just received. I see a hand up. I'm going to take it to Nick first. Nick, we're going to give you the ability to unmute yourself and share your minute public comment with this board.
Hello, thank you, Board of Supervisors and Dr. Moreno for that presentation. Yeah, I just wanted to see if we could add on to the health order to stop homeless sweeps, because, you know, for me, what I don't understand is that if we're, you know, having people shelter in place, right, that should also apply to our in-house population. So the county, you know, along the Pajaro Levee in Santa Cruz County and Monterey County lines are conducting a sweep right now that's, you know, displacing our unhoused community there and dispersing them throughout the community, potentially increasing spread of COVID-19 and putting even more undue strain on our healthcare system and ICU capacities. So I'd just like to urge Dr. Moreno and the County Board of Supervisors to add to stop the, you know, homeless sweeps or cleanups, which are basically a, you know, displacement of our unhoused community into this order. So thank you.
Thank you, Nick. I'm going to go to Aaron Peck next. Aaron, we're going to go ahead and give you a minute to share your public comment with this board. You should now have the ability to unmute yourself.
Thank you, supervisors, for your meeting today and for letting me speak. I just wanted to follow up with what Nick just mentioned, and I wanted to remind the Board of Supervisors that the CDC recommends that homeless encampments do not be disturbed during shelter in place, because it puts them at risk, and it also puts other residents of the county at risk. So I just wanted to reiterate that point. Thank you.
Thank you, Aaron. I'm going to go to River Neville next. River, we're going to give you the ability to unmute yourself and share a minute public comment with this board.
Thank you so much. My name is Reverend Novi. I am a resident of Seaside and Pacific Grove, and I teach in Salinas. I am just going to echo the comments of Nick and Aaron, excuse me, but I wanted to remind you that the zip codes where the highest COVID cases are happen to also be where many of these homeless encampments are that are being routinely swept. And the lives of these, you know, vulnerable people who sleep outside and their immune systems are compromised just because of that are very important, but also they go out into the community in the same shops and the same public restrooms as other people. And if you're talking about a shortage of beds in the ICU, there's also a shortage of beds in the shelters. So you can't expect that they can go somewhere. So please, let's just leave them alone. I really urge you to take urgent action. As you pointed out, this has become critical. Thank you very much.
Thank you, River. I'm going to go to Guadalupe Arroyo next. Guadalupe, we're going to give you a minute to share your public comment with this board. You should now have the ability to unmute yourself.
Hi, everyone. My name is Guadalupe Arroyo.
I'm a resident of Salinas, California. And I'm also going to comment on the fact that there are homeless people out there. We are in a pandemic. And these people have neither the city nor the county have provided shelter for them or any source of a service for them. So I do think that in order to stop the coronavirus, in order to stop the spread, these people need to shelter in place. And there's lots of people out there. So I definitely want to raise awareness on this issue because I don't think it's being spoken about much. And that is all. Thank you.
Thank you. Seeing no additional hands up on Zoom, I'm going to bring it into chambers. I see Mr. Wes White here. Mr. White, please come forward. You have a minute to share your public comment with this board.
Hi, Wes White, Salinas resident, co-president of Salinas Monterey County Homeless Union. Just trying to remind you of the CDC guidelines that would be better to follow, which first and foremost is no sweeps, allowing porta potties, 1 for every 10 people, hand washing. Even more readily available would be hopefully laundry and showers, would be a next step. Hygiene is certainly one of the most important factors in COVID. Hand washing being, we need to honor people for where they're at. It's really cold. There's no shelter available. You're going to close down this temporary shelter for the permanent shelter, so we're getting a zero net gain on our population of people that we're able to house or put into a program. Almost everyone is connected with HMIS and CARS, which kind of behooves you to a fiduciary responsibility to not be abusing them while you're saying you're helping them. The form of the shelter that they have is already cheap. It's costing you nothing to allow them to make the home that they're making for themselves. And if you can't help them with housing, you should stop destroying the ones they're making for themselves.
Thank you, Mr. White. Seeing no additional hands up, I'm going to close public comment, bring it back to the board. Before we undertake a motion or a vote, I did want to share some comments. For me, the small business community is part of my history. It's who made me the person that I am. And I never thought that I would be elected to office and take a vote supporting the closure of businesses. But standing here today, dealing with in the middle of this pandemic with the storm raging around us, I think it's the appropriate steps, and I want to applaud Dr. Moreno for all that he's done from the beginning of this pandemic to keep Monterey County in the condition that we're in today, which is a lot better than we would have been if we didn't have the leadership of Dr. Moreno and all the folks at the health department. It's been an incredibly difficult year for everybody in our community, and this decision is not one that we take lightly. It's, the first shutdowns, I was the one who had to call my parents to let them know that family business that paid for my upbringing and my college education needed to close. Those aren't easy calls to make. They touch you at the core of who you are, and you look at all the family members, I call them family members who work with us in our businesses, and having to let them know that we're closing the doors temporarily. Those aren't easy calls. And so we know what's happening in our community to small businesses, to hospitality, but also hearing from our doctors yesterday about the condition of our hospitals, the reality that we're at a functional zero without beds, staff. It's hitting home, and having a big number like 10 today hit the chart in terms of deaths, those are families. Those are 10 chairs that are no longer at Christmas dinner, at Thanksgiving dinner. I just want the community to know that for me, it's not a question that I take lightly, and I appreciate everybody's input over the last week as we have had a lot of input and shared input back across leadership here at the county. But I just wanted to share those comments before we opened it up for a motion. And I know I heard a motion from Supervisor Alejo, but I see a hand up for Supervisor Adams. Supervisor Adams.
Thank you very much. Dr. Moreno, I just wanted to get clarification on one thing. I know that the order indicates that we will be closed for 4 weeks, and that date would be January 10th. Does that mean January 10th, 12:01 a.m., or does it mean January 10th, 11:59 p.m.?
Thank you, Supervisor. And Les can check on this, but I believe that the way we wrote the order is that it is effect until 6 a.m. in the morning. What will happen is we will, on that Monday, what will happen is we will, right, and what will happen is, so that gives us 4 weeks. Supervisor, we're implementing this order and the restrictions 1 week after the other Bay Area counties implemented, 1 week after our neighbor San Benito and San Luis Obispo implemented because they were required to. And the way this order is written is we will, the Bay Area counties, their orders will end about 1 week before ours does. And so we'll be able to, I'll be continue to work with our Bay Area and other Central Coast colleagues and on a weekly basis to look at how this is going, making observations and tracking the metrics and to see what's going on in our hospitals. And when theirs expires, we'll have a 1 week notice of what they're planning on doing. And we will, and so it'll give us a little time to figure out what's the next appropriate step for us based on all our experience under this setting. We're also going to continue to work with our health officer, state health officer, as this rolls forward. There's always new issues that arise, and I just have to say I'm very enthusiastic about how California Department of Public Health has been very open and receptive to feedback, input from the locals. I think that's really, really important because the folks up in Sacramento, they rely on us. They rely on you, they rely on me, they rely on my department, and they rely on the hospitals to tell them what's going on, to let them know what's going on here locally so they can make informed decisions up there that impact all of this. So thanks for the question.
Thank you for the answer.
Okay, so there's a motion on the floor. Any additional comments?
Just a question, Mr. Chair. The public commenters raised questions about the homeless. It seems like it would be respectful to respond in some way to their concerns. Is there something that either Dr. Moreno or someone else can say about that?
I could provide, yes, comment on public comment, just a little bit. I can check with environmental health here in the health department. Environmental health, depending on the specific, the location and the owners of the private property that are involved, sometimes gets involved with these. So I can follow up to find out the more specifics of where this is happening and the circumstances that are driving the apparent need to relocate homeless individuals. Sure.
Thank you. And I know that the county does have resources for the vulnerable, unsheltered, to be able to quarantine or isolate if they're at risk of COVID. So I think a lot of these considerations at least are in people's minds. So I think, you know, I do appreciate the concerns. It's a tough time of year to not have shelter, and with the pandemic going on, it's even more stressful. But I appreciate you checking on what's happening and making sure that we're doing everything we can.
Okay, so again, we have a motion. I still need a second on that motion.
Second.
Got a motion from Alejo, a second from Phillips. Roll call vote, please.
Supervisor Alejo?
Aye.
Supervisor Phillips?
Aye.
Supervisor Parker?
Aye.
Supervisor Adams?
Aye.
And Chair Supervisor Lopez.
Motion carries. Thank you very much. With that, we're going to head into the first item that was scheduled before this urgent add-on, which is the approval of a historic property contract or a Mills Act contract. And the presentation will be made by Craig Spencer. Mr. Spencer, the floor is yours.
Thank you, Supervisor Lopez, and good afternoon, Supervisors. Craig Spencer with Housing and Community Development. I'll be brief. We have an application for a Mills Act contract on a property at 978 Pioneer Road in Pebble Beach. This is known as the Roland W. White House. The property was added to the county's historic register by this board earlier this year and qualifies for a Mills Act contract pursuant to county code. The Mills Act contract application was reviewed by the Historic Resource Review Board and unanimously recommended for approval to your Board of Supervisors. It would be a contract between the county and the property owner, where the property owner is agreeing to preserve and maintain their historic building, which is a Spanish eclectic building designed by Clarence Tantau, who also helped design the Pebble Beach Lodge, co-designed the Pebble Beach Lodge, and is a noted architect. And the contract in exchange would allow the property to be treated or assessed a property value under the Mills Act restricted value. And by doing so, the county anticipates approximately $8,000 in reduced property tax revenues to the county because of the reduced property taxes from this Mills Act contract. Staff is recommending that the board approve the contract in this case and find that it qualifies. And I'd be happy to answer any questions if you have them on this application.
Thank you, Mr. Spencer. I'm going to see if we have any questions from board members. Seeing no hands going up, I'm going to turn and see if we have any questions from the public. So again, we remind folks to use the raise hand function. It's at the bottom of your screen or at the bottom of your participants tab. If you're participating via landline and wish to be recognized, please use *9 to raise your hand. Seeing no hands going up, I'm going to close public comment and bring it back to the board for action.
Move approval.
Move to approve, please. Oops, I'll second it then.
I'll take the motion from Phillips, the second from Adams. Roll call vote, please.
Supervisor Alejo?
Aye.
Supervisor Phillips?
Aye.
Supervisor Parker?
Aye.
Supervisor Adams?
Aye.
And Chair Supervisor Lopez.
Aye, the motion carries. Thank you. We're going to head into our next item. Back to you, Mr. Spencer, for a similar contract.
Thank you, Mr. Chair, and good afternoon again. Craig Spencer with Housing and Community Development. This is another Mills Act contract application for Mark Hadaway, this time for a property at 9260 Pius Ranch Road in Big Sur. The contract would be for a home that was designed and built by William Vaughn Shaw, who is known as a master architect. He was a local architect who became the recipient of the Prix de Rome Art Scholarship and was also the second member of the local Monterey Peninsula AIA to become adopted into the College of Fellows with the AIA. It was his personal home made out of reclaimed timber from the Dolan Bridge that is now defunct. And this was also added to the county's register by this Board of Supervisors earlier this year, and in doing so qualified it for a Mills Act contract. This particular contract does require an exception to the maximum property valuation limits that are in the Mills Act contract requirements in the county code. The county code requires properties to be valued under $3 million for residential properties. This property has a current fair market value over $3 million. The exception was reviewed by the Historic Resources Review Board, and some concessions were made by the applicant, which include potentially opening up the home for a public tours and heritage tourism if they are ever allowed and begin to operate in the county, which would give the home some public exposure. It is fairly isolated. Staff did struggle with the recommendation on the exception, but the Historic Resource Review Board recommends that the board grant the exception. Staff is recommending that as well and approve the contract. Again, the contract would be the property owner agreeing to preserve this historic property in exchange for preferential property tax assessment. In this particular case, because of the value of the home, the projected property tax revenue that would not come to the county would be $36,000 per year. With that, I'll conclude my presentation. I'd be happy to answer any questions on this particular application.
Thank you, Mr. Spencer. Questions from board members? I see a hand up from Supervisor Parker.
Thank you, Mr. Chair. Thank you, Mr. Spencer. Question, not so much on this application itself, as it looks like it's been carefully reviewed by everyone and really vetted. But reading these two applications for Mills Act, what really got me thinking about the ones that we've approved over the years. Do we ever get a report on a, I don't know, annual basis or every 2 years on how all that work is going? Is there some reporting requirement that folks have so that we can keep track of the renovation and the preservation that's happening on these properties?
Yes, the contract itself does require annual reporting from the property owner who's in contract with the county. The county receives annual reports to ensure that investments are being made in the preservation and maintenance of the home. Part of the work plan or part of the contract is a work plan that is an idea of how they will invest money in preservation of the property over the course of the next 10 years. The contract, the way it works is that it is a 10-year contract that renews annually, so it's ongoing. We haven't come up against the 10 years for any of the contracts we've entered into yet. We're getting close on some of them, but there will be a need to revisit what the reporting requirements our work plan is at the end of that 10 years, which is something that we're looking at having historic consultants prepare reports for and make recommendations in terms of ongoing reporting requirements.
Sounds good. Thank you. I appreciate that. And, none of my business because I won't be here, but there might be some interest on the part of the board to have reports on all of the Mills Act properties every few years. You get the reports annually. You all may not want to see that before the board every year, but every 3 years, every 5 years, it could be really interesting for the board and the public to know more about how all this works. So just a thought. Thank you.
Any additional comments or questions from board members?
Following up on that.
I'm sorry, Supervisor Adams?
Yes, just following up on Supervisor Parker's comments, I wonder if that is something that we could charge the Historical Review Board with doing, to ensure that, to take a look at the reports as they come in, so that would just be another element of the work that they do. It might take a little burden off the staff. Thanks.
Thank you. I think that's a great suggestion. I'm going to quickly go to the public and see if there's any input on this item. I know we received a few letters ahead of time, including from the applicant. I want to see if anybody wants to share public comments. We ask that you use the raise hand function. Okay, well, I see one hand from Christine DeLorio. Christine, we're going to go ahead and unmute you and give you 1 minute to share your public comment. You should now have the ability to unmute yourself. Thank you.
Thank you. My name is Christine DeOrio, and with Chattel Inc. Historic Preservation Firm representing the applicant. The applicant is available to answer questions. We appreciate the staff report and the favorable review by the staff and the Historic Resources Board. We are happy with the recommendations. And again, the applicant can address any other issues. So please ask any questions of us if you have them. Thank you very much.
Thank you very much. See no additional hands up. I'm going to bring it back to the board. What is the will of the board?
Move to approve. The staff recommendation to approve.
I think I got a motion from Adams. Was a second from Supervisor Parker?
Yes, thank you.
Perfect. Okay. Roll call vote, please.
Supervisor Alejo?
Aye.
Supervisor Phillips?
Aye.
Supervisor Parker?
Aye.
Supervisor Adams?
Aye.
And Chair Supervisor Lopez.
Aye. The motion carries. Thank you very much. Our next item is going to be presented by John Dugan. Mr. Dugan, the floor is yours.
Thank you, Mr. Chairman, members of the board. Can you hear me okay?
Yes.
Yeah.
I'll share the screen. This is a public hearing to determine the application completeness for Vista Madera subdivision. Appeal of Planning Commission determination made on September 30th, 2020. Vista Madera LLC is the applicant. PLN number 990274. This is a de novo hearing to consider when and if subdivision application was deemed complete. The determination is not a decision on the merits of the project. It applies if the applicant decides to go ahead with the project. The full EIR, staff analysis, and public notice and hearing process will be required before a decision is finally made. Options for the board include to deem the application incomplete, that it remains incomplete, which is the Planning Commission determination. Determine that it's complete by operation of law on September 26, 2002, or deem it complete on some other date. The appellant proposes September 2nd, 2001. Key issues for this application involve, should this Vista Madera application have been deemed complete? No, it remains incomplete. If yes, what date? Tentative map is governed by rules in effect at the time the
Mr. Dugan, we're having audio issues. I think it has to do with your internet connection. And I think it's a rural broadband issue. We need to fix the digital divide. Perhaps you could call in to the number for the meeting on your phone next to you, and that would give us a more consistent audio feed. I think that's the issue, is we have audio cutting in and out.
Okay, excuse me, let me just try to do that.
Okay, why don't we go ahead and take a 5-minute break while we manage that, and then we'll come back.
Testing.
Hello, John. This is Julian from the Clerk of the Board's office. I have emailed you.
Yes, can you hear me?
Yes, we could
Probando
hear
el sonido.
you. I have emailed you the information to log in by phone.
Le han mandado la
Okay, I'm
información
logged in
para
by
que se
phone.
pueda comunicar con ellos por teléfono. En
I'm
un
logged
momento
in on phone
estaremos
by
con
my
él.
computer. Hello?
You've called in as well, John?
Yes, can you hear me?
We can hear you now.
I think he's ready to go.
Estamos listos para
Okay,
empezar.
let's go ahead and try this.
We got the PowerPoint up.
Okay. Go ahead and share your screen. We can't see your PowerPoint any longer. So go ahead and put that back up on the share screen function.
Is it up there now?
Okay, empezaremos muy pronto. Estamos
No, it's
probando
not.
toda la comunicación por teléfono.
Well, not letting me share the screen for some reason.
Chair Lopez,
Yes, Wendy.
I wonder if it's possible for Mr. Dugan to provide his PowerPoint to the clerk of the board, who could then, display it,
Thank
and
you,
then he
Wendy.
can just say
Yeah,
next
that's what
slide.
the clerk is working on. Thank you.
I think that he has a copy of it. I'm sorry that my screen isn't working right.
Okay, John, I'm going to go ahead and have Les Gerard share his screen. He has your presentation, so who's got it up now? Okay, Julian's got it. Don't worry about it, Les. Okay, so we've got it up on the screen now. Go ahead and let Julian know when you need your slides changed, John. Let's go ahead and try this out.
Okay. Let's start over again. Okay, so this is a de novo hearing on the Vista subdivision application for a completeness determination. The scope of the hearing includes to consider when and if the subdivision application was deemed complete. Determination is not a decision on the merits of the project. If the applicant decides to go ahead with the project, it's a full EIR, the staff analysis, public notice, and hearing process will be required before the application is finally made, or approval is finally made, or denial. Options include to deem the application incomplete, remains incomplete, which is the Planning Commission determination to determine the completion by operation of law on September 26, 2002, or deem it complete on some other date. The appellant proposes September 2nd, 2001. Next slide. The question then, key issue, should this Vistaneer application have been deemed complete? If no, it remains incomplete.
So I don't
If
hear...
yes, excuse me? Should I go ahead?
Go ahead and continue.
Okay. If yes, at what date? The tentative map is governed by the rules in effect at the time of the application of completeness. General Plan Policy LU-9.3, the subdivision application deemed complete on or before 10/16/2007 are subject to the county plans and regulations in effect when the applications were deemed complete. If the application is deemed complete prior to 10/16/2007, it's subject to the 1982 General Plan and the Carmel Valley 1987 Master Plan, which includes components of a preliminary scoring system for the subdivision and various Carmel Valley Master Plan policies concerning development. If it's deemed complete after 10/16/2007, it is subject to the 2010 general plan. The Carmel Valley Master Plan is amended, which includes the development evaluation system, the long-term sustainable water supply, and Carmel Valley build-out policy. Next slide, please. Now, in terms of some key dates related to this application, on 6/10/1999, an application request was received from the applicant, which is a pre-review of concept plans to develop an application checklist. In 1999, the board adopted guidance resolutions directing the staff to deny subdivision applications in Carmel Valley until the general plan was updated. The resolutions are referred there primarily to do with traffic issues on the primary highways. In 2000, the board amended the subdivision regulations Title 19. We're adding a sentence that says, when to deem an application complete for a subdivision requires proof of adequate public water supply as determined by an independent county contracted hydrogeological study. On 7/6/2001, the application checklist was given out to the applicant, which includes the requirements for hydrological information to show the water source, the quality, the quantity, and the assurance of a long-term supply. The application was actually filed and accepted by staff for processing on August 26, 2002, when applicants submitted some materials and fees. And then a letter was sent out on September 26, 2002, indicating the application was incomplete for many reasons, and including a hydrogeological report that was missing. Next slide. Next slide. Now, the board has several options in addressing this appeal. Option one would be the application is and remains incomplete. Staff has consistently determined over the last 18 years that the application is incomplete due to this lack of hydrogeological report required by the subdivision regulations. There, it's quoted there. No hydrological report has been submitted to date, so the board could determine, as did the Planning Commission, that the application was and remains incomplete. Next slide. Option two is to consider that state law requires the local agency must notify applicants in writing 30 days of submittal of the application or the application is deemed complete. The county accepted the application on August 26, 2002 for processing. A letter from the staff dated September 2002 stated the application was incomplete. However, September 26 is 31 days after the application submittal. So the board could determine the application was complete by operation of law on September 26, 2002. Next slide. Option three would be to deem the application complete on some other date. The appellant lists 17 points or contentions and issues in his appeal letter. He asserts that the contentions presented to the Planning Commission plus several others should be considered by the board. The application could have been complete on or before 10/16/2007. The applicant's contentions have been consolidated into 5. Next slide, contention 1. The county misidentified the date of the application, which was filed on August 1st, 2001. Therefore, the application should be deemed complete by operation of law. In response, the correspondence from the applicant's representatives from August 23rd, 2002 shows that the county and applicant were still communicating about the requisites for application submittal in August 2002, which implies the applicant's contemporaneous recognition that the application had not yet been submitted. Next slide. Contention 2. The failure to include with the application the adequate public water supply information was not proper standard or procedure and should not have been a precondition for determining the application complete. It is an issue to be evaluated during the project review, CEQA analysis, and approval denial process. In response, in September 2000, the board amended Section 19, et cetera, of the Title 29 of the subdivision ordinance to require that prior to an application being deemed complete, this hydrogeologic report had to be prepared by a geologist at the applicant's express under county contract. In the project referral sheet accompanying the September 26, 2002 incomplete letter, the Environmental Health Bureau staff notes that this hydrogeological report is necessary because the initial water use questionnaire indicates the proposed project would result in an intensification of water use. In 2006, staff was still requesting this information, and as recently as last year as well. Next slide. Contention 3, the county failed to accept the applicant's application and submitted on 8/23/2002, requiring communication from the applicant's legal counsel. In response, the county staff correspondence dated August 21st, 2002 shows that the county informed the applicant that the county was preparing the application checklist so that the applicant could submit its application. And the county did accept the application on August 26, 2002. Next slide. Contention 4, the Planning Commission failure to timely provide a written determination on the appeal within 60 days of the filing of the appeal on August 3rd, 2020, renders the application complete by operation of law pursuant to the Government Code Section 65943C. The appellant contends that the county missed this deadline because the Planning Commission's resolution on its appeal was mailed on October 15th, 2020, after the 60 days. In response, the Government Code Section referred to requires a final determination in writing on the appeal of the application and completeness within 60 days, or the application is deemed complete by operation of law. The County Planning Commission heard the appellant's application completeness appeal and made its final determination on September 30th, 2020, which is within the 60 days of the filing of the appeal. The written staff report and resolution, which the Commission adopted with one alteration made orally at the hearings, were provided to the applicant at or before the September 30th, 2020 hearing date. Therefore, the applicant received the written determination within 60 days. Clerical finalization of the resolution, a recording of the vote, and obtaining the chair's signature, the mailing of the resolution are ministerial functions, so that the fact that the resolution was mailed on October 15th, 2020 does not trigger the automatic completion date. Next slide. And finally, contention 5, the application was determined complete by the county but recommended for denial. The appellant is referring to a memo dated July 12, 2011 from the Environmental Health Bureau to the Resource Management Agency stating the application is complete with recommendations for denial because the applicant had not provided information demonstrating a long-term sustainable water supply. There's a second letter dated November 15, 2011 from the Environmental Health Bureau to the RMA stating the application is incomplete with recommendations for denial for the same reasons. These memoranda are not conclusive proof, but in any event, if the July memo were the basis for a completeness determination, it would be evidence for a July 2011 completeness date, not an earlier date. Next slide, please. In terms of CEQA, CEQA review is initiated when a project is deemed complete. This Nadura application remains incomplete and will require environmental review per CEQA when it is deemed complete. State law allows for 1 year to complete an EIR, except when the additional data is required, like the hydrogeological report in this case. In 2006, RMA offered the applicant the opportunity to initiate an EIR with a scope of services, including studies for the hydrogeological water information, traffic, etc., to address these missing information. The county received 2 proposals, and in 12/2006, RMA sent a letter to the applicant informing him that a consultant had been selected. The county also requested the applicant approval of the scope and the terms of the RFP and asked him to sign a funding agreement for the application to be paid for the services required. But no response was received or deposit submitted by the applicant, so work on the EIR was never started. Next slide. Our recommendation from the staff is to accept and consider the appeal of Vista Nadura LLC and Nader Aga. Adopt a motion of intent to find the application is either incomplete and remains incomplete, or complete by operation of law as of September 26, 2002, or complete on some other date, and continue the hearing to January 26, 2021, and direct staff to return with a resolution with findings and evidence. Staff is available to answer any questions. Thank you.
Thank you, Mr. Dugan. At this point, I'm going to turn to the Board of Supervisors and see if we have any questions or comments. I see a hand up from Supervisor Phillips. Supervisor Phillips.
Yes, Mr. Dugan, thank you. But when was the first time that the applicant, because it appeared that the applicant continued to communicate and correspond with planning department, but when was the first time that the applicant asserted that by operational law that the September 26th date was the effective date, since it was one day late?
After the planning commission, at the planning commission hearing, I believe that was on October 30th.
But back in later in 2002, 2003, was any assertion made at that time that we were one day late? The county is one day late, and it was mandated by operational law?
No, sir, that never came up in any of the records I reviewed.
Okay, thank you.
Supervisor Adams.
Has the hydrogeological study been done now?
No, Commissioner, we have never received the hydrogeological study. It has to, as you saw, the ordinance requires that it be contracted with a third party and paid for by the applicant, and that has never happened.
But that is part of what needs to be completed for the application to be complete.
That's been the contention for years.
Thank you.
Yes.
Any other supervisors at this point? Okay, then at this point, what I want to do is give the applicant the opportunity to share 10 minutes with us. I know Mr. Lorenzano will run the clock for me, and I'm looking for the representative. So let's go ahead and pull Mr. Hart over from the attendee side. And Mr. Hart, let us know if there's anybody else you'd like us to pull over for your presentation. You should now have the ability to unmute yourself, Mr. Hart.
Excellent. Thank you. No, I don't need anyone else pulled over.
Okay, the floor is yours.
Thank you. Preliminarily, I would like to suggest that the board separate the discussion of this matter into two parts. The first component being the question of jurisdiction and whether this board has jurisdiction. I strongly suspect that resolution of that issue will resolve this matter entirely. There are two possible ways to view the determination that was made by Mr. Dugan initially, and that was affirmed by the Planning Commission. It can either be viewed as exclusively a determination as to the completeness or incompleteness of an application under the Permit Streamlining Act, or it can be viewed as involving discretionary determinations or a director's interpretation, in which case the appeal would not be properly raised under the government code, but rather properly raised under County Ordinance 19.16. The applicant has appealed to this board only pursuant to Monterey County Code 19.16. If this board determines that the findings of the Planning Commission were exclusively a determination of completeness or incompleteness under the government code, then this board is not the proper place for appeal. It's via writ to the Superior Court, and we are filing such a writ. So this board is only being asked to consider those portions of the determinations of the Planning Commission and the Director of RMA that this board deems to be discretionary determinations, if any. And so county staff suggests that what appellant has done is filed an appeal of the determination of incompleteness under the Government Streamlining Act. That's simply not the case. That is not what we did. It's not what our pleadings say. It is, we expressly said that's not what we're doing. That portion of the appeal will be resolved by the Superior Court. However, one can conclude that there were portions of what Mr. Dugan concluded and of what the Planning Commission concluded that were something different than merely determining whether it was complete or incomplete. In particular, there were necessarily findings as to when the application was submitted. And that is important because here we had a pre-application that was filed in June of 1999. And each of the ordinances at issue here were subsequently adopted. There was a form of traffic moratorium adopted in late 1999. These provisions of 1903 regarding hydrogeological reports were adopted in 2000. And what Mr. Dugan concluded and the Planning Commission adopted was a determination that those subsequently enacted ordinances somehow applied to this project, despite the fact that the pre-application was filed before they were enacted. The applicant believes that that is a director's interpretation, that is an interpretation by the department as to the manner in which to apply these ordinances. And in fact, the record clearly shows that there was internal disagreement and differences of understanding within the Department of Planning as to how to apply those. Particularly, there's a letter from Ms. Whitney to the applicant on July 3rd of 2001, where she reports to the applicant that those subsequently enacted ordinances will not apply to this project because the pre-application was filed before their enactment. There are then a series of emails back and forth between Ms. Whitney and other members of the planning department over the next several days where they talk about that issue and the other members of the planning department disagree. And then the county refused to accept any more of the filings, submissions, applications, and money from the applicant for more than a year thereafter. So the question here for this board is, are there any discretionary determinations that were involved in what the Planning Commission did? If so, this appeal applies to those. If not, and this is as the county staff and county council purport it to be, only an appeal and all the Planning Commission did was make a decision under the government code, then our appeal doesn't touch that and you have nothing to address. We are not appealing under the government code, and that will go to the Superior Court. So that's the preliminary issue. And to the extent that you determine that it's solely determination of completeness or incompleteness, it's not proper to proceed with this appeal. And in fact, the appellant will withdraw the appeal to the extent that that determination is made. That's all I have on that issue. Substantively, I guess I have about 3 minutes remaining that I would address other issues once you make a determination as to jurisdiction. Thank you.
Thank you. We'll go ahead and pause your time there. I'm going to see if Council Strimling wants to share an opinion with us at this point.
Yes, good afternoon, Supervisors. Under Government Code 65943, that is part of the Permit Streamlining Act, and it provides a process for a completeness determination. And it states that if staff determines an application is incomplete, there is a right of appeal, which we have provided to the applicant. The government code also states that a written determination on that, the appeal must be heard within 60 days and a written determination made on that appeal within 60 days, unless the applicant agrees to extend the time, in which case there can be more time. In this case, the Planning Commission, we gave the applicant that right of appeal, and the applicant availed himself of that right of appeal. Planning Commission rendered a decision within 60 days. The applicant at the appeal hearing, we gave him the opportunity to extend the time so he could have an appeal to the board. Applicant's representative on the record said no, he didn't want that extension. However, a couple weeks later, after the resolution was mailed, the applicant availed himself of the right of appeal. So it's our opinion that he basically waived that 60-day deadline, and that he implicitly, if not explicitly, agreed to an extension of time for the Board of Supervisors to hear the appeal. But, you know, on the board, our opinion is that the board can hear this appeal as an appeal of the completeness determination under the government code, and that it's a de novo hearing. In the alternative, however, the board can hear this as an appeal of a director's interpretation. Initially, when the planning department was initially looking at this issue, they provided an opportunity to appeal the director's interpretation, but on further review of the matter, it became clear that this is really not appropriate as a director's interpretation because it's really quasi-adjudicative. We're not looking at broadly applicable rules, or we're trying to interpret something broadly as having general applicability, but it is more in the nature of reviewing how rules apply to a specific set of facts. So that is why ultimately RMA determined that it really wasn't a director's interpretation. So our opinion is that the Board of Supervisors should go ahead and have this hearing that is a de novo hearing. And I guess if the applicant files a lawsuit, we will have to, we'll make these arguments to the court that we believe the Board of Supervisors does have jurisdiction.
Thank you, Ms. Strimling. So at this point, I want to see if there's any additional questions from board members before I give the applicant the ability to respond with their 3 minutes. We'll go to public comment before we go back to the applicant, actually, but are there any additional questions from board members at this point? Okay, seeing no hands going up, what I'll do is take this out to the, oh, I did see a hand go up. Give me a second. Supervisor Parker.
Thank you, Mr. Chair. I was hesitating because I'm trying to figure out if I have a question and exactly what it is. This is kind of getting into some hair splitting that, is, beyond my, feels like it's a little beyond my pay grade or something that I wasn't quite oriented to think about. So I guess the, under the applicant's representative brought up the issue of a a pre-application and that should count as the application submittal. I think something along those lines. I guess, I found that to be a little unusual. And I guess I would just like staff to talk to me about how the process works. It sounds like a pre-application is what it says it is, and that an application submittal actually happens later. But if you could just reassure me on that point, I would appreciate it.
Ms. Trimlin or Mr. Dugan?
Yeah, I'm going to jump in and say this is a process that the planning department had where you submitted a pre-application. And now that was in 1999. Now you may have heard of the development, what do they call that? The DRC, which is sort of the same process that the staff has now. And I think Mr. Holm or Mr. Dugan may be able to shed light on how this worked back in 1999. But it's kind of the pre-application so that staff can find out what the applicant is thinking, and that helps the staff generate the application checklist. Because under the Permit Streamlining Act, the Permit Streamlining Act requires an application checklist, which is when you submit your application for X development, you need to provide A, B, and C information. And then when the applicant submits the application, they submit their application, their fees, and the items in the checklist. So then the completeness determination is, did the applicant provide the reports and items that were in the application checklist? So the purpose of the pre-application process, and now the RMA use the DRC process, is to kind of find out what the idea is, the concept, and come up with that application checklist.
I see, and I think there was a reference in the materials that I read to the fact that through that process, the pre-application process, there was something that indicated that there might be an intensification, or probably would be an intensification of water use. So that was part of that pre-application process, which then meant that the checklist would have to include something to deal with that. I see. That's helpful. I just needed to understand where the different elements lined up, because I think in some way it is going to have something to do with, when the application was received, when it may or may not have been deemed complete. So yeah, that's helpful. And of course, if Mr. Holm has more, I'm happy to hear it.
Sure, I'll maybe add a little bit. Wendy covered it pretty well, but yeah, back in 1999, it was Planning and Building Inspection Department was the department where applications were submitted to. The application request is as referred to a pre-application. It was like a $200 fee for staff's time to go out, take a look at the site, look through the codes, see what types of things are going to be required as part of the application. And it was standard practice. And it would include the fees that were required when the application was submitted too. So all the fees weren't even paid at that stage. It was just a minimal amount of money for staff to look at what's going to be needed in the application. The intent was to try to get more complete applications coming in when they're ready to fully submit all the information, the fees. Then that would trigger the 30-day review period. That was the standard practice for planning and building inspection back then.
Thank you.
All right. Seeing no other hands up from supervisors, we'll open it up to the public at this point. I'm going to ask that folks use the raise hand function that's located at the bottom of your screen or the bottom of your participants tab, depending on your setup. *9 will raise your hand if you're participating via landline and let us know you wish to be recognized. We're at 1 minute per public speaker. The first hand I see up is from Pris Walton. Pris, we're going to go ahead and give you the ability to unmute yourself now and share a 1 minute public comment with this board.
Okay. Thank you, Supervisor Lopez. I'll be just very brief. We fully support the staff recommendation that this application be deemed incomplete for all of the items cited that they're missing, and particularly the issue of water. You should have received a note from our attorney who also reviewed the case. Hopefully it got there in time. And so basically we support both the planning Commission's determination that it's incomplete, and support the staff's recommendation that it is incomplete. Thank you.
Thank you, Ms. Walton. At this point, I see no other public hands up, so I'm going to go ahead and close public comment and bring it back to the board. At this point, we have 3 minutes left on the clock for the applicant, and I want to go ahead and give them the opportunity to respond to any public comment or what they've heard from the board before we bring it back to the board officially. Mr. Hart?
Yes, thank you. The applicant's position is very clear. To the extent that this board seeks to use this proceeding to revisit the question of completeness or incompleteness determination under the government code 65943, this appeal is withdrawn. That is not what the applicant has requested. It's not what the appeal was. And this proceeding, that is not what this process is for. And Ms. Strimling is not allowed to change what our appeal is. Our appeal is our appeal. And it is not about a government code determination. And so if that's what this board believes this appeal is about, we withdraw it. However, if this board believes that this is about discretionary determination, then, and this board finds that there were discretionary determinations made, or directors' interpretations of the provisions of the county code, then we would proceed only as to the appeal under County Ordinance 19.60. And one of the issues that was raised by Supervisor Parker was, what is the meaning of a pre-application and what is its effect? And the straight answer is that the whole purpose legislatively of a pre-application is to mark a point in time and a line in the sand as to, at that moment, only those local ordinances in effect at the moment of the filing of the pre-application apply to the application. Admittedly, it is not an application. The application comes at a later point in time, but the whole purpose legislatively for enactment and allowance of a pre-application is to say only those local ordinances in effect at the time of the filing of the pre-application apply, regardless of when the ultimate application is submitted. And so that's why that's an important question, because what is being requested of the applicant thereafter are submission of additional information that was not enacted at the time the pre-application was filed. Thank you.
Thank you, Mr. Hart. With that, I'm going to turn to County Council.
Thank you, Honorable Chair, members of the board. I want to give some guidance here. In my opinion, it is too late to withdraw the appeal. The board has jurisdiction. The arguments have been made. I think the analogy is you go to the Court of Appeal on a case, and the court's going to say, sorry, you can't withdraw your appeal. You've briefed it, we've debated it, and we're going to make a decision. So my recommendation, however, is that you can treat the decision on both bases. In other words, you can say, if this was an appeal pursuant to the government code, this is what we find. In the alternative, if this is an appeal from a director's interpretation, we also find this. So I don't think you're precluded from making alternative findings, but I do think it's too late to withdraw the appeal.
Okay, so with that clarity, I want to go back and see if we have any additional input from Council Stremling.
No, I completely concur with the county council.
Thank you very much. Okay, I'm going to go back to County Council.
Thank you. And I do want to emphasize the point that the pre-application is not the application. The pre-application was designed to aid in the process so that the applicant could make the application. So the pre-application date is not the date to focus on here. It's the actual application date. I just wanted to emphasize that. Thank you.
Thank you. Appreciate it. With that, I'm going to turn to the board and see what the will of the board is on this application. I see on this appeal, sorry, Supervisor Phillips, I'm going to you first.
Yeah, I mean, maybe the county screwed up by sending this a day late, but I think they got the information at pre-application. Maybe it wasn't completely encompassing, but they clearly knew that the hydrological study was going to be necessary. If we missed it by a day, then there was obvious communications that went back and forth between the county and the applicant. So the applicant, I don't feel, was blindsided or didn't know what was occurring. And the applicant sat on their hands for years before they ever said, well, you missed it by a day and you screwed up. So, yeah, the applicant seems anxious to get it into court, which is fine. And that's what we pay Mr. Gerard and his staff for, to deal with it if we're big bucks, I might say, if we're wrong. But the record is here. So, it's not a thing that the court's going to have to spend a lot of time preparing a record on it. And if that one day, it sure puts form over substance. And so I don't think it's right. I don't think the applicant was unfairly treated or was misled. And so I would affirm, however we're going to do it, affirm what was done at the unanimous decision of the Planning Commission. So,
thank you, Supervisor Phillips. I'm going to go to Supervisor Parker next.
Thank you, Mr. Chair. I've been trying to think about, well, the only reason I can see for just in this case where the application is clearly incomplete and has been for years. The only reason I can see for making up a date and saying that it's complete is to allow the applicant to just stop the back and forth. Let's not be in the position of this toing and froing with an applicant, and just allow the process to move forward and see if this is a project that would be approved based on the environmental impact and so on. But even that idea doesn't seem very fruitful, because precisely that opportunity was offered to the applicant in 2006 and was not followed through on. So I really feel, whether we're under whatever code or anything we're operating, I think it's clear that the applicant has been in the process of thinking about a project for a long time, and that the processes for submitting an application and making sure it's complete and following through the process to allow the project to move forward. It's a pretty clear process. I mean, people do it all the time. We deal with projects and developments all the time. So I just feel that the staff has been more than accommodating to this applicant, and it's just clear that this application has not been complete, and it's not complete today. And I don't see a reason to try to make up a date upon which we can just say it was complete. I just don't see the value in that at all. So thank you for the opportunity to review this, and I look forward to completing this deliberation.
Thank you, Supervisor Parker. Supervisor Adams.
Thank you. There has been a lot of back and forth on this, and it's a very complex issue. But it appears to me that there is simply plenty of evidence that the application was incomplete even in subsequent years. There's so much evidence in my mind that in the record that supports the staff's findings that the application remains incomplete. And as I had asked earlier on, is there a hydrogeological study done yet? And the answer was no. So it's still incomplete. I concur with the comments made by the Planning Commission, and feel like we really have no choice but to support option 1 of the staff's recommendations and request the staff return with a resolution containing the same findings and evidence as the Planning Commission did.
Is that a motion, Supervisor Adams?
Yes, I'll make that as a motion.
I'll second that. And another thing that I find compelling is the point that Supervisor Phillips raised by his question, that this whole question of the operation of law was never raised until just recently. So as I say, I think the applicant has been fairly treated all the way along, and I support the determination of the Planning Commission as well.
Thank you. Any additional comments from supervisors before I call for the vote?
Yeah, Supervisor Lopez, I was just going to say that I certainly, after looking at all the materials and reading the staff report, our staff's recommendation, and the comments by my colleagues are all points well made for the record. That it's hard not to. We just can't oversee that what evidence is before us. So I think I will support staff's recommendation, and for this to come back to us for a final vote at the end of January.
And I'll concur that I believe that the evidence is pointing in the same direction. I appreciate my colleagues. And before we call for the vote, I see Council Stremling chomping at the bit. So Council Stremling, the floor is yours one more time before I call the vote.
Thank you. And are we continuing the hearing to a date certain? I think we recommended the January 26th date.
I imagine that's included in the motion maker's motion.
I
think that's staff recommendation.
Yes, that's absolutely yes.
Okay.
Thank you.
We have a motion, which is staff's recommendation, along with continuation to a date certain. With that, I will go ahead and ask the clerk to give us a roll call vote.
Supervisor Alejo?
Aye.
Supervisor Phillips?
Aye.
Supervisor Parker?
Aye.
Supervisor Adams?
Aye.
And Chair Supervisor Lopez.
Aye, the motion carries. With that, we've concluded the item. We'll head into item 4.1. This is a presentation from Lori Medina, our Social Services Director, with a team behind her, which is Lauren Suwansampa, Anastasia Wyatt, Roxanne Wilson, Katie Castagna, Josh Matfis. And so with that, I will turn the floor over to Lori Medina.
Thank you, and good afternoon, Chair Lopez and honorable members of the board and members of the public. As was forestated, I'm Lori Medina, Social Services, and I have quite an ensemble with me, as the chair just acknowledged. And we'll try to get through this as expeditiously as we can, but we want to make sure that we give you a complete picture of what's being considered. As you're aware, we've been working for quite some time on programs and services that support persons experiencing homelessness and housing insecurity. And since the pandemic, these services have become even more critical and really required us to activate a variety of other programs to support our most vulnerable populations through a variety of funding sources, including the CARES Act funding plan that you heard a presentation about yesterday by Budget Director Ezekiel Vega. Although the CARES Act funding ends on December 30th of this year, we know that the need really continues. So we're here to discuss some of these programs and present some options for your consideration about what, if anything, will continue after that date. And I want to start our presentation by introducing Lauren Suwansupa and Anastasia Wyatt, who will begin this discussion, and they'll introduce some of our other team. And then I also want to just mention that at the end of the presentation, our interim finance director, Becky Cromer, will also be available to help field any fiscal related questions. So with that, Lauren and Anastasia, you're on.
Thank you so much, Lori. And Chair Lopez, members of the board, thank you for this opportunity to provide our update and a little summary for you on where we're at in some of the future considerations for our programs that serve our vulnerable populations. Our focus today is really on the CARES Act funded programs, but also some of the other services that are linked to those programs and that are providing our community with our some critical resources for preventing, responding, preparing for all of these things with the impact of the coronavirus. You know, through the CARES Act, lots of new and innovative programs were established to support our homeless and very low income residents. So I want to cover today the Project Home Key, our rent utility assistance, sanitation stations, the warming shelter, our share center, the homeless outreach team by CSUMB, and Project Room Key. There's a few partners here, and I want to start off with Anastasia Wyatt, who is going to talk about Project Home Key. Anastasia.
Thank you, Lauren. Good afternoon, everyone, Chair and members of the board. We want to quickly discuss Project Home Key, which it was a really great opportunity that the state provided to transition people from Project Room Key into permanent housing. And so Project Home Key, there was 20 million available to our region, which included all of Santa Cruz County down to a little bit into Ventura County, Santa Barbara County. Only 20 million. The county, the city of Salinas applied for the funding and was awarded 9.2 million to purchase the Goodnight Inn in Salinas. And so this was this will house 101 units for permanent supportive housing for clients that are 0 to 30% income, and it will provide 2 manager units. So there was also a contribution with the county Department of Health of $100,000, and then $800,000 of the county's HHAP funding to support the operational costs. So thank you to the health department for stepping in. Both the Department of Social Services and the Department of Health also provided, and the CAO's office provided letters to support this funding application. It was a very quick turnaround, 3 weeks basically, to put this application in and come in with a project. So we all worked very collaboratively to ensure that this happened for our region. And we will be bringing in a new service provider to the region from Southern California, which is Step Up. Step Up is going to manage the units. And we were very lucky because as we get into some more of the slides to detail the funding, Step Up came in with Shangri-La Construction, which was their development partner and their contractor, and they are putting in a lot of their own money to make this project happen. So it's a great partnership. It's very innovative. It's something that's never been done in our region. So we're really excited to see this new type of collaboration. There is going to be some ongoing costs of about $300,000 annually. We think this will start probably in FY 21-22, but for right now, we're in good shape. Next slide, Lauren. So this is a little bit about the overall budget here, the development budget. And you can see that we have that it, boils down to 16 million to acquire this property, and then for all of the different development fees that come in to make the project happen. And Project Home Key funds came in at 7 million. Shangri-La Construction came in with their private investment of over 9 million. So there is the city also received 2.1 million, and we'll get into that in addition for services. So because this is supportive housing, permanent supportive housing, there are permanent supportive services to ensure the population maintains housing and stays housed. Step Up has an excellent track record of keeping people housed. They're at 97% of people stay in their housing within a year, which is great track record. So we're very excited to see that happen. So these are some of the operational costs, lots of different funding sources that went into those operational costs. There's Home Key operating. The city of Salinas received 2.2 million, again, out of an additional fund the state came up for those operating costs, because this is to make these projects happen throughout the state. And we also had ESG COVID with the city of Salinas came in. Salinas is using the permanent local housing allocation, PLHA. Some of the HAP coalition funds are coming into this. And the county is also using the HAP and some health funds to ensure that in future years, we're going to have the funding for the operational costs. That's kind of the difficult part of permanent supportive housing. Now, I want to bring Roxanne Wilson, the director of the coalition, to talk a little bit about the partnership that occurred here with the project-based vouchers that are going to be worth over 16 million over the 20 years of the life of this project. Roxanne?
The truth of the matter is, if we weren't able to get vouchers, the likelihood of us receiving the funding to purchase the motel would have been like non-existent. The only way that we were able to pull this together was in strong partnership with the Housing Authority and several service providers. Because the Housing Authority has to have an open and transparent process when it comes to project-based vouchers, we had to really be innovative on how we were going to obtain those. So we worked with the service provider network. I believe that there's about 12 agencies that are able to make referrals to another program called the Homeless Set-Aside Voucher Program. And we had over 200 vouchers in the Homeless Set-Aside Voucher Program. And the agencies, myself and Jose Gomez from the Housing Authority, met several times to discuss if the agencies were willing to forfeit any number of vouchers to make this project fly. And after several meetings and points of conversations and negotiations, we had the service provider network had agreed on forfeiting 85 homeless set-aside vouchers so they can be converted to permanent supportive project-based vouchers, excuse me. So that by itself took several weeks for us to come to an agreement, but I do think that it is worth us mentioning because it wasn't just, the coalition or the county or the city. It was also the majority of the service provider network that had to pull together to make this project fly.
Thank you, Roxanne. And this was all done in a very short time frame. So kudos to everyone who was involved to make this happen in record time. So, but again, using those vouchers on a permanent supportive development that is going to basically turn around within months is a lot easier than trying to find landlords and all of the hard work that goes into that. So we're in really great shape being able to bring 101 permanent supportive units online within a matter of months. So I wanted to mention that I came to the board in the spring on the permanent local housing allocation. You saw that the city of Salinas also utilized this funding. I've spoken to cities throughout our county about how we're going to utilize these funds. We are still waiting for the state to make a final determination on our trust fund application. So I'm hoping that, keep your fingers crossed. And but our permanent local housing allocation, this is the way we said we would utilize those funds up until 23-24, which is how long the application is for. We do have to reapply annually to make sure our goals are still being met. But you can see that we have budgeted operational costs that could be utilized for the Project Home Key in the future if needed. So that 300,000 that I mentioned, we do have some 200,000 annually up until 23-24. The coalition there is also an opportunity that the coalition we can apply for HUD funds that would be ongoing to also step in, and then these funds would be freed up for other permanent supportive housing developments, which we also have 3 projects coming up with No Place Like Home that the county was awarded in last spring as well. So there's plenty of need for these operating reserves for permanent supportive housing to ensure people get the services they need in that permanent housing. So just so you see that there is budget in there for it through this PLHA funding. And we also have budgeted funding for navigation centers, which we will be opening up our navigation center soon. So Lauren is going to talk about that a little bit later. So anyway, that is the gist of the PLHA funding. Thanks, Lauren. All right, so one of our other big partnerships that we wanted to discuss here is our partnership on rent and utility assistance that we are working on with the United Way, with Josh Madfis and Katie Castagna, the CEO of United Way. They're going to discuss the rent and utility program. And I just wanted to mention that when we were talking about this presentation earlier today, they said, "Oh, we're just a small piece of all of this," and this is a huge piece. So, Katie, I wanted to make sure we thanked you hugely for the partnership that you're bringing to ensure that this rent and utility assistance program also comes off the ground, because this is a really important program and it takes a lot of manpower. So, thank you, Katie. I'll hand it over to you and Josh.
Hi, everybody. This is Josh. I guess I'll go first, and then Katie will follow. Just as a reminder, the program leverages the 211 information and referral call center, and so residents call that, and then the call specialist would do an intake and an eligibility survey, and if they're eligible, they would refer to one of 10 agencies that are paying for rent and utility assistance, and then the residents can choose which one that they want to receive the benefit from. So it's been a flurry of activity. We've had some really strong partnerships. To date, we've had 276 households benefit from the program, 188 households for rent, and 154 for utilities. They've spent $543,278 in benefit assistance. And so we're working really hard to get that rest of that funding spent out, and our partners have assured us that they can do it. They have reported back some really just heart-wrenching and heartwarming success stories of individuals and families that have been really distraught and really stressed with having to make hard choices between paying for car repairs or family supplies for their families, provisions, or paying for their rent or utility bills. And they're really relieved to be able to make this payment and not have to really make those tough decisions. Many examples of folks who've been laid off from their jobs and just couldn't pay the assistance, and we're grateful for it. So it's been really meeting a need. Some of the challenges we've heard is just clearly that the time frame has been a challenge for our partners to do this within the 3 months window that we had. And then just, there's an eligibility requirement. So gathering income eligibility documentation has been a bit of a challenge. And then sort of communicating with landlords and getting their participation they needed to provide a W-9, a letter or a lease, and so sort of communicating why it was important, and that's been a bit of a challenge. Our agency partners really value each applicant in each case, and so they want to work with them and really reach out and help them to get the benefit. And it takes time, and they really own each application. So I guess that's what I wanted to report on. I'm going to hand it over to Katie for the next piece on what's coming forward.
Thank you, Josh. Good afternoon, everybody. And I'm just so proud to be part of this collaboration, not only on behalf of United Way, but the effort and leadership that's come out of the county for this whole continuum of care has been amazing. We wanted to share with you a little bit about another piece of the success of this program is leveraging existing resources. And we can go to the next slide. As Josh said, people can access the program by calling 211 and getting pre-screened and actually enrolled. But we couldn't do this without agency partners who are actually providing the boots on the ground, the screening and fulfillment, and actually paying the rent. So we have put together a collection of 10 agency partners to provide this service throughout the county. And you'll see we did some specific outreach to municipalities to make sure that we were covering South County. So we're really pleased to be working with the city of Gonzales, King City, and Soledad. And we also have some typical or some more countywide nonprofit organizations. The Housing Resource Center, Salvation Army of the Monterey Peninsula are typically in this business. We've also leveraged utility providers, including Central Coast Energy Services and Monterey One Water. And then to make sure that we're really touching the need in the North County area, we're working with Pajaro Valley Prevention and Student Assistance. And then one of the newest partners in this type of work is Goodwill Central Coast. And they are also really doing a big lift countywide with helping people access this benefit. As Josh said, we've been able to spend over $500,000 in a very short period of time. Since we launched this program in mid-October, referrals to that intake process through our 211 system have totaled over 1,700 intakes. We are answering a lot of phone calls, and it takes a lot of time to go through each person's individual situation. And I'm really pleased that we are able to, as a county, offer one front door and make that easy and available to people 24/7. So we're really working very closely with the partner agencies to ensure that the money is well distributed and spent. So for some, it's going faster. Others, we can reallocate funds if it's going slower than expected. And as Josh said, the challenge has been the timeline. And I think the aspiration for all of us is how we help people going forward beyond December 30th. So there are some other programs we're working on, but I want to just stress that we've built capacity, not only for the 211 system to do this kind of intake and screening, but these agencies we're working with. And I expect we will continue to do more of this type of work. Another funding source that United Way works with is the Emergency Food and Shelter Program. And we have a similar structure with agencies that have received that EFSP money to help coordinate the allocation of rent and utility assistance. And this year we've allocated over $640,000 for that program, again, for rent and utility assistance. Going into the future, we're also talking to the county about perhaps using CDBG funds for assisting people with rent and utilities. And I think the concern is making sure that we don't just hit a cliff and turn off the tap in helping people access assistance to stay housed. So I want to thank the county staff who's been working so hard, and then the leadership and vision of the Board of Supervisors to put money into this immediate system. And I want to assure people that we have built the capacity to continue doing this and provide real-time access for people who need help. And I'm going to transition now back to Anastasia. Thank you.
Thank you so much, Katie and Josh. Really appreciate all of that awesome work. Now I wanted to again introduce Roxanne Wilson, the Executive Director of the Coalition of Homeless Service Providers, and she's going to start her discussion on the sanitation stations that are another key COVID piece that and service we've offered throughout the county. Go ahead, Roxanne. Roxanne, I think you're on mute. Sorry.
Roxanne, you're on mute.
Oh, it's the phrase of 2020, isn't it? Hello, everyone. Thank you so much. So back in March, the coalition, well, the continuum of care, I do want to acknowledge the Leadership Council as a key player in all of this as well. Representing the Leadership Council in this context had deployed several sanitation stations throughout Monterey and San Benito counties. And we did this because we realized that the number one thing we needed for our population, the population that we serve, to do is to have access to hygiene. As bathrooms were shutting down across the county, we were starting to see a huge need. People were unable to wash their hands. They were unable to use the restroom. So we used the HEAP interest funds for deploying these sanitation stations. Earlier in the process, our staff had reached out to all of the city managers of the jurisdictions in Monterey County, and then Supervisor Alejo had also assisted with getting us connected with the Mayor's Association, so the mayors were able to step in and say if they wanted sanitation stations in their jurisdictions as well. And what you see here are the jurisdictions that responded. With the exception of Pajaro, we did have some out there recently, but unfortunately they were vandalized and we had to have them removed. Nonetheless, the most important thing that I would like you to know is we believe that because of the sanitation stations, in combination with other things that other services people are receiving, we were able to really mitigate the risk of the spread of coronavirus throughout the homeless population. As an example, we had coordinated COVID-19 testing in Chinatown and in Sherwood Park, and over 11 weeks, there was 275 tests that were administered, and there was a 4.7% positivity rate. Most of those actually came from one encampment and not the other. We believe that because people had access to these services, as I mentioned earlier, they were able to clean their hands and before they eat and after they eat and before they were sharing things. So it is a huge component to trying to slow down the spread. It is also something to note that we were actually ran out of funds for this quite some time ago, but Supervisor Alejo did ask the coalition to see if there's any other ways we can keep this going. So we had redirected $60,000 of our administration money to keep sanitation stations out until March. But we do anticipate in March those funds will be depleted. And that's all for this. Lauren?
Thank you. Next, I want to talk about the warming shelter. Although this isn't a CARES funded project, this program played a really critical role in providing shelters, meals, showers, and really quite simply a safe place to shelter in place. Early on in the pandemic, the warming shelter was converted in order to accommodate 24/7 access so that people who are living without housing have a safe place to shelter during the pandemic and follow those stay-at-home orders. This is a congregate shelter. It serves approximately 80 people a night, and it is a partnership with the city of Salinas and is funded by a very unique collaboration of city and county funds, including regional funds like HEAP and the Emergency Solutions Grant. We'll say this program is scheduled to transition to closure as per our MOU with the city due to the opening of our new navigation center, the Share Center. The Share Center is the official name of our new navigation center. This was identified after a public survey process and is the Salinas Housing Advancement Resource and Education Center, the facility being under construction at 845 East Laurel in the city of Salinas. It is a congregate shelter facility. Our pre-COVID estimates were for it to serve approximately 100 people per night. That may be temporarily reduced to support COVID-safe operations when it's ready. The facility is intended to be more than a shelter, hence that term navigation center. I think it's an important distinction that a navigation center is a center that includes services like housing navigation, wraparound services, and that utilizes best practice methods like housing first, trauma-informed care. I will say the RFP for the operator of this center is active in process now, and of some of the proposals received, it is estimated that the operational cost could be around $3 million annually. This project also falls under our MOU with the city of Salinas, and the funding will continue as a shared partnership. Right now, we have identified HAP funds and some of the city administered regional funds to support the operations for the first year. I also want to invite back Roxanne to also speak about a really amazing project that we recently had come online for the homeless outreach team provided by CSU and Monterey Bay. Roxanne, do you want to share a little bit more about what CSUMB is doing and what the program is providing?
Absolutely. Every time I think about them, I smile because it has been a long time coming for us to have an outreach team that serves the entire region and is not specialized to any certain type of population. What makes this outreach team so different is we are actually mobilizing case management. We are truly trying to meet people where they are. This is a different model than what you would see with traditional outreach teams. And I'm not here to slam traditional outreach teams. There's definitely a place for everybody at the table. But a traditional outreach team would engage with you and then build the trust and then ask you to come to their office so they can start the case management work. Whereas our outreach team is doing the case management on site. I do believe there are many county officials who have encountered the outreach team. They are currently helping with the cleanup in Pajaro. We will be meeting also with another one of the supervisors, I believe, tomorrow about another encampment that is surfacing, I believe, in Carmel. So they are wonderful, ambitious, young, energetic students or MSWs, and they really bring those core competencies from their educational background into the streets, and we are so grateful to have them. At this point in time, there are 3 outreach teams, and they all have 3 people. The 3 people do include a case manager, a housing navigator, and also a team lead. We have been using this outreach team to start geo-mapping encampments around Monterey County as well, and they will also spearhead the entire South County point-in-time count that we're going to do in January. So we're again just so happy to have them on board.
Thanks, Roxanne. So currently the outreach program is a pilot project that is operating out of Project Home Key, but realizing, such a bigger need, we hope to see the service, be provided in a broader manner. There is an agreement that will be coming to your board in January with under HAP funding to continue the service for a 6-month gap in which the city of Salinas is intended to support this project utilizing their regional funds, the Emergency Services Grant. So we do have a plan to have the outreach team become part of our community for through the term through 2022 at this time.
Lauren, if I just may throw one more thing in there.
Of course.
You may notice that there's a huge spike in the cost of the outreach team, and that is because once the city of Salinas picks it up, they will add on 2 more teams of 3. So those two more will hyper focus on the city of Salinas while the rest of the outreach team focuses on the remainder of the county.
Thank you for adding that, Roxanne. Yeah. Okay, finally, the last project I really want to talk about is Project Room Key. Very briefly as an overview, this is a non-congregate shelter for our homeless residents who are identified as medically fragile because they meet a list of very specific medical conditions indicating, you know, they could be more severely impacted should they become infected by COVID. Since it became operational in May 2020, served over 300 people. The Coalition of Homeless Service Providers and their service network took over operations from direct county management in early September. And really through that collaboration have just infused a concentrated effort of case management, housing navigation, substance abuse counseling, mental health support. I mean, just a great collaboration of resources to give this vulnerable population some safety and to get onto a path to some housing stability. I want to have Roxanne provide a little bit more detail about what the coalition and those subcontractors have been providing for this project.
We really had to think way outside of the box because the folks that we're serving are generally people who have been living unsheltered for an extended period of time. The majority of them are chronically homeless and hyper complex situations. So as Lauren mentioned, we did have substance use treatment. We still do have substance use treatment. Mental health services are there. We do have 2 clinicians on site all the time. We have overnight staff, but we also did these other things. We help them apply, register to vote. We help them with doing their census forms. And now we're going to have a pet van come and do the spaying and neutering of the animals because we do realize and understand that their animals may present as a barrier to housing. So we have gotten them connected to a licensed clinician who can certify those animals as emotional support animals. So so then people could take those animals into their homes and it wouldn't be presented as a barrier. I can really go on and on and on and on, but I'm so proud of the work that has been done. And I'm also very grateful for the county, for Lori, for trusting us and starting the conversation to see if the coalition was willing to take on this very complicated project, and also to the Board of Supervisors for all of your support as well, because it is expensive and we acknowledge that. But this is really what it's going to take. So thank you all.
Yeah, keeping in mind all of that, those, you know, collaborative services, when you think about the average cost, we are about $575,000 a month or $4,800 a client per month. But it really includes a robust set of services that we believe are what is getting these people on track and onto housing plans. Back to just talk about some of the lessons learned and the partners that it took in order to make an effort to really address and meet these individual needs, Roxanne.
Yeah, one of the things that we really, that we know for sure is that without housing navigation services, there will be no housing outcomes. So over the past maybe month and a half, we've hyper-focused on creating housing plans that were very detailed. You will see, I believe on a future slide, what those plans revealed as far as where people are planning to go. We also are in full support of wraparound services. If it was not for the social workers, if it was not for the clinicians, we would not be able to do the things that we were able to do, because we're dealing with a population and in which many of them are very unstable, have been unstable for quite some time, and really need those wraparound supports. And some folks have a preference. They don't want to work with this agency, but want to work with this agency. So having those long-standing relationships that people have established outside of Project Room Key, having those representatives on site has been proven to be very fruitful as well. Another thing that is huge is we probably wouldn't have been able to create so many housing plans if there wasn't this crazy deadline that we're facing. As it stands right now, Project Roomkey is slated to close on December 30th. And if it wasn't for this, I don't think that we would be able to do the things that we did, but it was hard work. It was absolute difficult, long nights with our team, lots of overtime to make it happen. But thank you, Lauren.
Well, we want to talk about how that hard work has paid off, though. And here's a little summary of the transition strategy of the guests who are in Project Roomkey. Sam, do you want to provide some details what we're looking at here?
Absolutely. So the last time we updated this slide was, I believe, quite a few days ago when it came to this. As of right now, we do have 93 households with 120 individuals that are inside of the project. Something that is incredible to note is that of the people that are there, we have been able to get 15 homeless set-aside vouchers for people. And also there are 24 homeless set-aside vouchers for individuals that's currently in progress. The plan is for 7 individuals, we're talking about individuals in this slide, not households. 7 individuals will be going into transitional housing. So that's mostly House of Peace or the Veterans Transition Center. One client has opted to relocate, so we are trying to get her connected back with her family on the East Coast. 12 clients are actually going to the market, and usually that's because they are voucher holders. There is one case where the income, although low, it doesn't meet the minimum threshold for them to get into most programs, or the maximum threshold, excuse me. So we are trying to think of or we're working on rapid rehousing services for those folks. 8 individuals are going into bridge housing, so that's Community Homeless Solutions. We have only identified 1 to go into the Sprung shelter and 1 that we're trying to reconnect with interim, but there's 52 that have been identified to go into Project Homekey, excuse me. And 26 have multiple interventions. So multiple is usually Project Homekey and they have a voucher. So really they're going to go to wherever they can go first. Something also to note is that we do plan on moving 66 individuals out by the end of next week. Most of them will be going to Homekey, but they will also be going into the bridge housing project as well.
So just taking a beat, because I know it's a very simple slide here, but this is really some of the most impressive data that I think we have shown you so far, just with how many people we're talking about and the amount of work that's gone into creating housing plans for all of the people in Project Roomkey so that this vulnerable population has a permanent place to go and have some stability. I just in awe and in recognition and thank you to Roxanne and the community of partners that went to make all of these things happen. As you can see down at the bottom, we really are looking at a much smaller amount of individuals who still need some support and services. Right now, all of this impressive effort is being made by our community of providers to develop these transition strategies for all of the Project Roomkey participants. But we are proposing that there is going to be a continued need for Project Roomkey beyond December 31st. For a small number of the guests who were not able to place immediately, Project Roomkey would continue to serve this critical function. We are proposing a scaled down program that could be established due to this amazing housing effort that the coalition of providers have made. We're estimating approximately 25 or 30 rooms. The cost of this for what we estimate is need of about 6 months, $2.19 million. Right now, CARES Act is what funds the program, and we have talked throughout this presentation is set to expire at the end of this month. We did receive an allocation. Governor Newsom had announced $62 million of the Disaster Response Emergency Operations Account, RIOA funding. The allocation for Monterey County is $456,994. The program does continue to be eligible for specific services that are eligible for FEMA reimbursement, but that continues to leave us a gap of about 1.7 million to continue these operations. We collaboratively throughout our county partners have been considering what funding sources we can use to support the program. We have looked at HAP, Round 1, HEAP funding, and whole person care, all of which are currently being used in the various projects that we discussed earlier in our presentation. Upcoming, we are aware of some funding coming in the horizon, the CDBG that Katie Castagna mentioned that we're considering for rental assistance, and HAP Round 2 also on the horizon. However, it may not be available in time to help us in the immediate need. Finally, we are asking the board to consider a couple of options. Our current Project Room Key guests are, being assessed and having lots of housing plans. We do believe that there's a small number who will need additional time and would utilize Project Room Key to support them as we provide them continued services. Option 1 is a short-term extension. It would continue the program at that scaled down 25 to 30 rooms and utilize the state's DRIOA fund and continued FEMA reimbursements. We estimate with that funding and the reimbursements, we could continue for approximately 2 months. There is always a potential that additional state funding could become available, but once those funds would be exhausted, those who were not placed would need to leave the motel. Option 2, as with option 1, continues the program at approximately 25 to 30 rooms with the DRIOA and FEMA reimbursement, but also requests an additional county investment to provide us a reasonable amount of time to fully engage our case management and housing navigation support every guest in establishing a housing plan. At this time, I invite questions as well as Becky Cromer, our finance director, to help navigate any questions or thoughts on this. And with that, I will wrap. Thank you so much.
Thank you, Lauren. I want to see if we have any questions from board members at this point. I'm going to go to Supervisor Phillips first. Supervisor Phillips.
Yeah, I do want to say just about the presentation before I ask the question is I'm really impressed when you hear how much we're doing. A lot of it, I didn't even appreciate how much we're doing for hopeless. I hope those people who were on the call earlier were concerned about the homeless to see how much we are doing. And I saw it firsthand with the services that were brought in to assist us in a really difficult situation in Pajaro to deal with the river situation. I guess my question is, have we approached the Community Foundation, who I know is very concerned about homeless, and looking to see if they could help with some of the funding for Project Room Key?
I would invite Becky Cromer, our finance manager, to kind of discuss and help with some of our finance-related questions. I know that we have been working with various partners to kind of help out in various projects and services that are happening throughout the community. I have not directly engaged with the foundations, but I do know that they are very active in working directly with many of our local providers on some of their urgent resources and services that they're trying to provide just to continue normal functions. It's always actually something that we can continue to pursue and talk with our foundations about.
Okay. Thank you, and thank all the presenters. It was an impressive presentation. Thank you.
Thank you, Supervisor. I'm going to go to Supervisor Parker next.
Thank you, Mr. Chair. Thank you for this presentation. It's always so impressive to learn more about the work that you're doing, the community partners, and just the caring and creativity that people show to really make better things happen for our community members. I think this is an illustration of why it's going to be important for us to have a comprehensive look at what services will need to continue into the new year and really look at where the funding may or may not come from. So for me, I want the program to continue for 6 months, but I don't think that we're in a position in this piecemeal way to say, oh yes, this should continue and we should allocate this money. So I'm leaning towards the 2-month option to revisit early next year to say, okay, what do we know about other funding sources that are coming forward, and really try to be cohesive and coherent about the whole thing that we're doing. But my question is, you're talking about reducing the number of people and rooms, people to be served, and the number of rooms. I'm just concerned about people getting kind of hurried out before they really are as stable as they need to be in the various ways. Can you talk to me about how those decisions are being made? Sounds like a bunch of them are moving, but how do we make sure that people are really ready and it's not just some end of funding that we're talking about?
I think that we hear a lot about, how quickly we're trying to get people into permanency, but into the housing, but it also is in alignment with, think you hear the term housing first a lot. And that really, it is a best practice in that, to say someone may not be ready for housing, may not, everybody is ready for housing. Whether or not we need to ensure that they have access to continued stable support to keep that housing stable for them, that's really is very important in making sure they have permanent supportive housing. But we do recognize that everybody is ready to be in a safe place and to have housing. So I think that our focus really needs to be on ensuring that they are supported in that placement wherever they go in those options. And that's really where our key focus is. Not that we're trying to rush people out, but that they deserve some stability. And then our focus is on ensuring that that support is there so that place is safe for them.
So the people who are moving out to various housing is the Good Night Inn or whatever it was in Salinas, is that ready for people to be placed into for transitional housing, or are they going to be going to the share center? Well, probably many places, but it looked like a number of people were planning to go into kind of a transitional housing situation.
Yeah, I think maybe Anastasia could talk a little bit about what the Project Home Key and what the Good Night Inns type of what permanent supportive housing looks like for those.
Sure. So Supervisor Parker, to answer your question, their Project Home Key is the big transition from Room Key to go into Home Key, as many people as possible. And I think, Roxanne, you had mentioned about 50 people will be transitioning from Room Key into Home Key. So a great transition from the hotel they're into a permanent supportive housing model. And in order to transition into Home Key, we're purchasing, the city of Salinas is purchasing the hotel, and it's going to take time, probably, I think about 1 to 2 years for them for Step Up and Shangri-La Construction to turn each individual unit, those 103 units total, 2 will be manager units, 101 will be units for extremely low income people who need that housing. And in the meantime, they will move 50 people in within, I think, 1 to 2 months of the close of escrow, which is supposed to happen quite soon. And so those people will move in, and then they're going to do they need to, do construction on each unit so that each unit becomes a permanent supportive unit, which requires a kitchen and just some minor modifications. This was a very new hotel built in the 90s, so there's not a whole lot of, and it was recently renovated, so it's not going to take a whole lot to do that transition. But within 2 years, so that is considered interim housing for 2 years and 1 to 2 years, and then once that's complete, those units will be permanent. And we are hoping that those people who are transitioned into Project Home Key will remain there, you know, throughout this interim timeframe while the units are converted and into permanent housing. And based on Step Up's record, we expect that that will be the case.
Mm-hmm. Thank you.
Thank you, Supervisor Parker. Supervisor Alejo.
Thank you. Certainly want to support all these ongoing efforts, and I don't see any problem coming back in a couple of months versus 3, knowing that there's so much changing right now, and hopefully by then we will have a greater certainty of whether there's another round of federal funding or state assistance coming to us. So I think either time frame works out. But I did want to just acknowledge all these different efforts because they didn't happen by chance. Some of these efforts are very intentional at our county level. I think the board made a commitment to reorganize our housing team and to pull in talented people that didn't want the status quo to stay as it was. And I think Salinas has Megan over there, and she's also wanting to push the envelope and think outside the box, partner with other organizations that have a track record of doing well. And with their homeless coalition, we have an energy and a cooperative spirit there that I think among different elected officials and homeless service providers, we're able to move things further along. So I think our county has really come a long way, but our report card to the community is yet to be given. We have the shelter coming online early next year. That's going to be a great accomplishment to be able to provide greater services through this permanent year-round shelter. And this Project Home Key, the Goodnight Inn, another great step forward, even though we're having to open only using half space because of the pandemic. It has 101 rooms, but as was just stated, we can only use half of them at this time. And I did want to acknowledge the Housing Authority, who also has new leadership. Jose Gomez came back from the Bay Area, and he's really moved things around there. And certainly without him, and his leadership really moving some things around in terms of the vouchers, we probably wouldn't have got that project off, as was already mentioned. But from all fronts, from the Coalition of Homeless Service Providers, housing authorities, the city, the county, we have staff that want to do better and are actually moving projects that I think elevate our efforts and our effectiveness to address homelessness in our county. And even after these projects are done, we're going to have to do more because we're just beginning. And so I want to just state that all this great work is happening, but even then, we're just addressing a fraction of the need that is out there. And so I hope that once we get these projects done, that we will manage them well, that we could show the community that we could serve homeless residents without many of the problems that often come to people's minds when we talk about our homeless population. But then use that experience and that track record to show the community that in Monterey County we could do for other projects that could be done well and serving our most vulnerable homeless folks in our communities. So with that, I certainly want to be supportive of this proposal today. Thank you.
Thank you, Supervisor. I'm going to go to Supervisor Adams next.
Thank you, Mr. Chair, and thank all of you for the wonderful presentation. I think all of you know I was head of United Way for 14 years, and one of the best things I ever did was hire Katie Castagna. But beyond that, I can tell you that having worked for so long, trying to address the problems that you are facing so well, it's just absolutely uplifting. I'm just so pleased to see the collaboration that's going on and the way that each organization just seems to tie in so neatly with the others. I'm really just delighted by it. But the problem has only gotten worse. There's no question. And I fear that it will continue to do so. And I did have a couple of questions because honestly, I feel like, oh my God, I didn't even realize that this was out here. I'm so excited about it. So kind of tell me some of the things about the timeline. So are we able to be in the Goodnight Inn now, or do we have to wait? I understand that it hasn't closed escrow yet, correct? So that might be at the end of this month. So tell me about the timeline. So with Goodnight Inn, with the shelter, the new shelter. I know that's ours, but God only knows if we have any issues like we had at either juvenile hall or the jail, we may never be in there. Let's hope that doesn't happen. And then where the people now who are in Project Roomkey, where are they staying at this point?
Thank you, Supervisor Adams. So I will speak to the Share Center is on track for completion in February of 2021. The RFP is active, and we are looking to nail down an operator very shortly, to be able to announce that right after the new year. The operator is set to be in place and operational by April 2021. I want to ask Roxanne if she can answer your question about the timeline for Project Homekey, because she meets regularly with the operator on the Step Up group.
Thank you. So they are slated to close escrow today. They were waiting for the state to get them over the standard agreement, and the state was supposed to produce that today. It was on schedule. So I still have not received word yet. I'm sitting at the edge of my seat waiting, because we are scheduled to start move-ins on the 15th. So next Tuesday, the first 12. I know it's nuts, but the first 12 wave will go in, and then we're going to do 12 every single day following until we hit the maximum number, which is, I believe, 51 at this point.
Are those 12 coming from the current shelter that we have downtown on Alice South Street?
No, these are Project Roomkey.
So these are the Roomkey people, not the home.
The Project Roomkey participants, yes.
Okay. Sorry.
Roomkey will be moving to Homekey. Yes.
Got it. Okay.
It's fun.
The Roomkey guests really are prioritized in ensuring that they continue to maintain non-congregate shelter because of their higher vulnerability. Yeah. Those who are in the warming shelter, due to some higher health abilities, are able to remain in congregate settings, although we have lots of safety precautions in place, and would likely have those guests would likely transfer to the Share Center.
Got it. Thank you. And
Back
then
to you, Supervisor. Oh, were you done, Supervisor?
No, that's okay. Yeah. So with Roomkey, though, is Project Roomkey in force now?
Project Roomkey is active now. It is in a confidential motel location in Monterey County.
Okay, it's only one motel. Okay, got it.
One motel.
Okay, thank you very much.
Back to you, Supervisor Alejo.
Just one question that was brought up, I think, in the Coalition of Homeless Service Providers meeting, which was those residents that are in Project Roomkey, the hotel room program. That program is winding down unless the state gives us another round of funding. But there's and the 50 rooms at the Goodnight Inn are opening up, but there was a number of residents that were because of the limitations of 50 rather than the 101, we're going to be in limbo, not being able to transfer. And I had asked, I think, Anastasia to, for those numbers, I don't know, one, how many do we have in that limbo situation? I certainly don't want to have them go back into the street during the winter and during this pandemic. What's the plan for those, and whether there's a request being made so that we could keep those people housed at least a little longer until we perhaps get another round of state or federal funding.
Would you like me to speak on it, Anastasia?
Yeah.
So there are the problem with Project Homekey is the entire first floor is going to be the first to be renovated, in addition to all the ADUs. So for Project Roomkey, that means all of our first floor guests and all of those with disabilities will not be able to move forward quite yet. That number is about 17. There are also other people who were waiting for their vouchers to come into fruition, or were waiting for their birth certificates to come in. When you add up the number, we're actually at about 35. So we are trying to work with the city of Salinas to take some folks because they do have a voucher and they really are just they're kind of in they're almost housed situation, which is where we came up with that 25 to 30 number. But the truth of the matter is we really have about 35 folks that that may not be ready to move out by December 31st.
So will we get a plan of what we can, this board, or perhaps in partnership with the city of Salinas, can do for those residents? I don't want to hear, but come the end of December, going into New Year's, that we have several dozen residents having nowhere else to go, because then we will have no ability, no meetings to be able to provide resources to be able to care for them.
I do believe that our ask today is for an ability to negotiate and have our director execute a contract extension for Project Room Key. We are asking for that smaller amount, but we would like to see Project Room Key continue beyond December to be able to support exactly that population that you're referring to.
Okay, so they are covered in this plan. Thank you very much, Mr. Chair. I'd like to make the motion at the right time. Thank you.
Thank you. At this point, I'm going to open it up for public comment. We have not yet done that on this item, so I'm going to go ahead and start with folks on the Zoom. I ask that you use the raise hand function at the bottom of your screen or at the bottom of your participants tab. If you're participating via landline, *9 will raise your hand and let us know you wish to be recognized. At this point, I'm going to go to Antoinette Gorosh. I'm going to ask Julian to give you the ability to unmute yourself. Annette, you now have 1 minute to share your public comment with this board.
Thanks a lot. It's Antoinette Goro, and I am a resident of Salinas. I guess having been on this meeting pretty much all day at this point, the biggest thing I would like to comment on is the vast disconnect there seems to be with the presentation I just saw and the unhoused people that I have met and seen with my own eyes, the sweeps I have seen with my own eyes, as well as the public health crisis we are in. I mean, despite your good intentions, the resources are not getting to the people who need them. I mean, I hear you guys talking about these places that are going to be open in a year after the winter. 10 people died of COVID this year. These places we're talking about are the highest concentrations of COVID. These two things are connected. Supervisors, please keep asking these questions. We need more specifics than have been given here. What is up with this money? Sorry to be so impassioned, but I live in a high-risk household.
Thank you, Antoinette. I'm going to go to Grant Leonard next. Mr. Leonard, we're going to give you the ability to unmute yourself. You have 1 minute to share your public comment with this board.
Good afternoon, Chairman, Board, and members of the public. Grant Leonard speaking to you on behalf of the North Monterey County Recreation and Park District. I wanted to thank the county and the United Way for letting us partner with you on the rental assistance and utility assistance program. We were able to help 15 households in North Monterey County and distribute over $36,000 in aid. As Josh mentioned, a lot of the stories we deal with are very heartbreaking, but it's also very heartwarming to be able to know that we assisted these families, especially during the holidays when people were choosing between gifts for their family or paying the rent. There's no question this is absolutely a needed program now, and we look forward to hopefully getting additional funding from our friends in Washington, D.C. And at that point, we look forward to continuing to partner with the county and the United Way so that we can continue to help our residents in North Monterey County. Thank you so much.
Thank you, Mr. Leonard. We're going to go to Aaron Peck next. Aaron, you should now have the ability to unmute yourself. You've got 1 minute to share your public comment with this board.
Thank you for taking my comment, Supervisors. I just want to say that that I think it's totally unreasonable, all the money that's been given to the county, and there's still people sitting outside tearing down their houses in the middle of winter. And I personally witnessed somebody who froze to death on the street, and I'm really disappointed in our county at this point. There's no reason that anybody should still be out there, and all the work that you're doing, it doesn't count for anything unless you come home at the end, right? I mean, that's the point of your services, right? So I think that you guys need to focus on that, because people don't deserve to die like that, and they don't deserve to live like that, especially. Thank you.
Thank you, Aaron. We're going to go to Nick next. Nick, we're going to go ahead and give you the ability to unmute yourself. You've got a minute to share your public comment with this board.
Thank you, Chairman. Yeah, I just want to reiterate that the fact that, we need to expand our reach here in the county because, based on the homeless count, the census in 2019, we have 2,422 homeless people. Now, 9.2 million for the Good Night Inn, 118 served. I mean, just some simple math of money over individuals, that's 78,000 per individual served. So it's just like, where is all this money going if not directly to serving more people? So talking about CSUMB, right, expanding that team to 15, that means that's 161 people per person on that team to serve. It just doesn't seem reachable or adequate at all to address the gravity of the crisis. So, we need to think about expansive terms of, re-examining our budget and really aligning our values to serve these people, because we're in a critical state right now with the pandemic and the housing crisis. And on top of that, continuing these sweeps while this is happening.
Minute is up. We appreciate your public comment. I'm going to go ahead and, without seeing any other hands on Zoom, I'm going to go to folks in the room. Mr. White.
Hi, Wes Weiss, Linus resident. $1.5 million reallocated. That's great. I mean, you got 91 households and 116 individuals, but where's the rest of it? You need another 30 times that, because we got 3,000 people in this county that are unhoused right now. So if we're working on a solution really hard for this 3% of the population, what are we doing to the other 97? Well, it's sweeps. You're not following the CDC guidelines either. There's no porta potties at all along Pajaro at all, and so that's going to be gone. So who cares? But you're supposed to have one for every 10 people, and you're supposed to have hand washing. None of that happens. So you folks don't even follow CDC guidelines to begin with. Then you're going to pat yourself on the back, give yourselves money when you're not only tackling maybe 3% of the problem one way, humanely, and then 97% of everyone else just gets thrown to the meat grinder, and that's wholly unfair. You need to work holistically instead of piecemeal. 3% is failing.
Thank you, Mr. White. Go to Pamela Weston next. Pamela?
Hello. We came before you with the oral report regarding the city of Salinas on September 2016. Instead of dealing with unhoused, we need to deal with continuity of care. For the people who are on industrial Sanborn and Rico Rossi, they were moved to Sherwood. The people in Sherwood got COVID. The evacuees from fires were able to be housed, but we need to deal with things differently. And when we went before Jane Parker and Armenta and this Board of Supervisors, it wasn't about housing. It was about continuity of care. It's about safety and protection. We didn't have a cars that was correct. The civil grand jury investigated. We're not doing anything different if we're going to put people in house of peace and only deal with 50 residents. As you know, Chairman, your family was even impacted. We need to do it differently, and it's not about doing it the same. Thank you very much.
Thank you, Ms. Weston. At this point, I see no more hands up and nobody in room. I'm going to go back to the board. So at this point, it's back in the hands of the supervisors. Is there at this point any additional questions?
I'd like to make a motion that we
Supervisor, I've got that. Let me go to Supervisor Phillips first. Supervisor Phillips.
I would just say that I don't want to see the project room key just drop off the board. So, but I agree with Supervisor Parker. I don't know why I'm agreeing with you so much. Maybe it's just your swan song, but I agree with her that we should keep it going, but not make the full commitment in option 2, because we got to see what is happening from federal and state, maybe some money coming in and other things. So I think that'll give us enough time to take a look at it in January to see whether we want to extend and put some more money into it. So I would support when the motion is made to support option 1. So.
Thank you. I'm going to go to Supervisor Adams next.
Thank you. Yeah, I'm sitting here looking for option one because I must admit that with all of the different things being suggested, okay. So that would determine that the sorry, I'm looking at the wrong one. So if you could please just tell me what option one includes, I would appreciate that.
Lauren, could you do us a favor and put back up your presentation with the options and show us option one within the slideshow?
Here you go.
Okay. And so I don't see a cost. So this would not be asking for additional money at this point. It would just be going through until the funds that you have now are exhausted.
Correct.
Okay. Okay. And thank you. Thanks very much. That sounds good to me as well. Thank you.
Okay. And just for clarity, unfortunately, Supervisor Parker had to drop off, and this is a 4/5 vote. So I'm going to go to CAO McKee after that clarification.
Thank you. And another clarification, I just want to be clear. I think that FEMA reimbursement will be sought. It's never guaranteed, as far as I understand.
Okay. So with that, Supervisor Alejo?
Yeah, I'd like to make the motion that we approve staff's recommendation under option number one. And I just wanted just to briefly make a comment just in response to the concerns. I appreciate those members of the public who come and be a voice for our homeless residents. Is very much needed because they do rarely have a voice in these decisions. But I would encourage you to attend some of our meetings with the Coalition of Homeless Service Providers, our continuum of care, because we are doing work. I know the public doesn't always see it, but doing God's work and addressing homelessness, it's not easy. We get a lot of pushback at every step, but we are moving forward, and we are keeping the bathrooms. The funding ran out, and we put almost another $100,000 to keep those portable bathrooms out in different parts of the county. We can help when people damage them, such as the Pajaro case, when they're vandalized and damaged. That does create issues there. So doing this work has never been easy, but I did want to give a shout out. I forgot to mention Roxanne's leadership. She's also new at the Coalition of Homeless Service Providers, but another new leader who came in and really wanted to tackle this crisis in a different way. So I just want to applaud her leadership, as well as I forgot to mention that earlier. Thank you.
Thank you, Supervisor. So first, let me see if there's a second on the motion put forward by Supervisor Alejo.
Second.
We got a second from Philip. So I just want to echo Supervisor Alejo's comments there at the end that over the last few years, we moved the ball significantly from where we were not very long ago. That happened because of the reformation of some of the groups that got some leaders at the table. We got a lot of recognition from the state due to the leveraging of our local voice, and we saw a lot of the product of those changes today. Those systems were put in place long before COVID. It wasn't like these incredible people who've come out and told us what they've been able to accomplish in light of COVID did this just starting in April of this year. This has been effort on the ground over years by several different boards that predated me, and I'm just appreciative of the efforts that have gone in looking at projects like Room Key. While we say it's just 100 rooms, but those are rooms that are going to be available to the community in perpetuity. These are major changes, and so I appreciate all the work put in by every single partner on this call, and we can continue to downplay the successes, but there's more in the pipeline, and incremental change is real. It's coming, and it's been in the pipe, and I appreciate every single person's efforts because I know that every single day they get up and go to work and work on behalf of all of the residents of Monterey County, whether they rent a home or are homeless, have a roof over their head or not. These people care, and that's why we're here today putting forward a project like this that's going to continue to give opportunity for folks to stay safe in light of the situation that we're in. Change continues, and it comes every single day. And with that, I'm going to ask the clerk to give us a roll call vote.
Supervisor Alejo?
Aye.
Supervisor Phillips?
Aye.
Supervisor Adams?
You were muted, Supervisor Adams.
Thank you. Aye.
And Chair Supervisor Lopez.
Aye. The vote carries. With that, we have concluded our business for the day. I'll turn to council to see if there's anything to read out from our closed session.
Nothing to report out, Chair. Thank you.
Thank you very much. With that, we are concluded. We will see you Monday. Just for a brief opening, Supervisor Adams, I see your hand up, old school.
Thank you. Thanks very much. Old school is right. So I just had a request, to the County Administrative Officer. In the past, we received like a monthly tally of what the amounts were, both in the cannabis assignment account, as well as what was in the contingency fund. And I would also ask that we add in the strategic reserve. I feel like I would benefit from seeing what the drawdowns have been and are. I know we used to get it, but I think since COVID started and we aren't all there, I haven't been seeing it. So that's a personal request. Thank you.
You mean we got money left in the cannabis? We got money left in the cannabis account?
I don't think so.
Let's get rid of that.
That's what I'm thinking. I'm thinking that we're going to have to pay some back somehow. You've been overdrawing.
All right, order. We are adjourned for the day. Thank you all, and we'll make sure to get to that request, Supervisor Adams.
Thank you very much.